What's going on, world? Welcome. Today is Monday. I was about to say today was Friday, but today is definitely not Friday. Today is definitely Monday after Black Friday. Today is Cyber Monday. You guys already know the deal. You guys already know what we're going to be doing today. We're going to be doing NCLEX questions. And at the end of that, we're going to do an Ask Me Anything, hang around for a little bit, talk about the 7-day NCLEX course, a couple of things that are coming down the pipeline that I want to talk to you guys about. And yeah. If you're new here, if you're not new here, you guys already know what the deal is. Y'all already know what the deal is. Smash that like button. Make sure you guys share. Make sure you guys follow. Make sure you guys give me all those likes because, you're not selfish your whole life. Or are you? I don't know. But if you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse. Been a nurse for 3.5 years. Been in the Navy for 16. Been coaching and mentoring pretty much my whole adult life in regards to military, being a corpsman, and now that transitioned that into nursing. So, it's been fun. It's been fun. Didn't get the deal before Turkey Day. So sad. What? You can still get the deal. Right now it's $97. Right now it's $97. And actually for everybody that gets it today, I am going to add in the NCLEX victory guide, like the complete guide. It's like over 780 or like over 700 pages, has pretty much everything that you would relatively need to know for the NCLEX. And you get all the free updates. So just like with the 7-day NCLEX course at $97 and you get all the updates that I add. If I revamp or if I move some stuff around or if I update the ebook for the NCLEX guide, you get that as well. So if anybody's interested in that, check the link out in my bio. It is labeled 7-day NCLEX course. It is going for $97. And that actually ends today. So it says M Cozy. It says, thanks, Kevin. I attended a lot of your videos here on TikTok. Wait, hold up. All right. Okay, Mike Cozy. So, hey, everybody right now, go and give M Cozy love. Congratulations on passing your NCLEX. Welcome to the greatest shit show on the planet Earth, known as nursing. Doesn't matter if you're RN or an LPN. Congratulations. If you got one thing to pass on to everybody that is going to take their NCLEX, and especially for those that are graduating soon, what advice would you give them? Wasn't it like 13 before? Was what 13 before? No, so if you're talking about the ebook, it was not $13 before. It's always been $29 actually. Just completed NCLEX right now. I did 86 questions. Did I pass? I don't know. Bill, did you pass? You should have a guide for new nurse grads. We lost, brother. Look, hey, I'm working on a lot of stuff. Karam, what's up? How are you? Out here being a nurse and still attending. I love it. What's up, user 14, Montego Bay? Always there. And Bonnie says NCLEX December 19th. Bonnie, I know I've seen you tell me that a couple of times. So congrats to you. Shout out to you. You're going to do well. 18th is right around the corner. So you got plenty of time to still get some knowledge in. Yes, you are the best. Hey, I appreciate you. I appreciate you being here. Your nice words. Hey, so you guys already know the deal. Smash that like button. Make sure you guys share, follow. We're going to be doing NCLEX questions, okay? The more that you guys share, the more that you guys follow, get it out to those people who need it. All right? A little bit about me. For those that don't know, I have taken my NCLEX 3 times, y'all. 3, and I passed on the 4th, but none of y'all would have known that at all unless I actively told you that, right? So I have no problem telling you what failures that I, Kevin, have gone through in order for me to become a nurse. My journey to become a nurse was started in 2012. Then I got deployed, which delayed me a whole year. And so from 2012 all the way to 2020 was a nursing journey for me. Karen, thank you for the teddy bear, right? So I understand where you are in the aspect of nursing school, failing classes, failing tests. Look, I've been there, right? But this is why I did this, right? Passed on the 5th time. Karen, that's what I'm talking about. You pass on the 5th time, right? But no job is ever going to care. No job's ever going to care. No recruiter's going to be like, oh my God, Karen, oh my God, you failed. I don't know if they're going to hire you. No one's going to do that shit at all. All right. No one's going to do it. So I'm here to tell each and every one of y'all when we do these questions that you're not a failure. You're not a fuck up. You're exactly where you're supposed to be. All right. Fucking putting in that work. Right. You put in that work and we make shit happen. All right. Hey, we got 130 some people in here. I'm done running my mouth, at least for now. I'll turn around and we'll get this thing popping. OK. Hey, you guys already know the deal. We're doing a little bit of housekeeping real quick. Hey, so we're doing NCLEX questions for RNs and PNs. OK, make sure you guys participate. Kind of funny. Today's Monday, so we'll see how that goes, right? It says, just a quick question. Do they care if you are a new grad trying to get into ICU with grades? No. I don't know who came up with that shit telling you that you needed to have a high GPA to be an ICU nurse, but they are lying to you. Participate. All right. Share, follow, give me all those likes. That's what I need. That's what TikTok needs for us to get us out to those right people. Okay. So don't be selfish your whole life. Hey, if you come to my chat and you act up, I promise you, I'm going to ban that ass. Literally, I'm going to ban that ass on a shirt. Hey, who would buy that if I did that? Nurseslabs.com is where I got these questions from. Okay. Make sure you guys go over there and check those out for yourself. The 7-day NCLEX course, Black Friday, Cyber Monday deal, lifetime access, $97. Hey, also, if you buy it starting from right now until midnight, I am going to throw in the NCLEX Victory Guide, which is over 700 pages of information that you need to know in regards to NCLEX, from medications to pharmacology to EKG interpretations to all kinds of stuff. All right. So make sure you guys check that out. And without further ado, let us jump into the questions. Oh, let me put y'all on a timer because obviously y'all take too long, right? All right, here we go. Question, how do you study for community though? I don't know how to study. I am Miracle. Hey, I do coaching as well, so you guys can check that out as well. But here we go. Question number 1. A 28-year-old male has been found wandering around in a confused pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed first? Is it blood sugar check, a CT scan, blood culture, or arterial blood gas? All right. So some of these questions to you may feel easy, all right, depending on who you are. I'm just going to lay this disclaimer out there right now, is that if they're too easy for you, cool, I get it, all right? But there are some people who are not where you are in regards to nursing school or higher levels of medicine, all right? So don't come in here acting a fucking turd, all right? Yeah, I called you a turd. I'm just letting y'all know, all right? 10 seconds, y'all. 10 seconds. What are we thinking? Hey, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Hey, we need 10,000 likes. We need 10,000 likes. We giving out all this good info. I need some likes. We got to give some give and take, baby. All right. What are we thinking? What are we thinking? Oh, you're right. Some of us just don't know everything. We still learn. Exactly. I understand that. Other folks don't. So I have to check people to let people know that, hey, you may not be there. Some other people are, so I'll check you. All right, here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A. I want to check the blood sugar. With a history of diabetes, the first response should be to check the patient's blood sugar. Okay, so a patient is displaying those signs and symptoms. The very first thing is I want to check the patient's blood sugar. That is reduction of risk potential. Yes, the least invasive, right? Reduction of risk potential, that is anywhere from 6 to 9 to 12% on the NCLEX. Okay. Hey, remember, you need to study content. You need to study questions and answers along with a rationale. Okay. You need to do that. There are no tricks to studying for the NCLEX except putting in the fucking work. You got to make shit happen. All right. That's the only way to study. Like, tricks are for kids. All right. If you want to be a trick and a kid, then go somewhere else. All right, here we go. Question number 2. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of potty training? The age of the child's ability to understand instruction, the overall mental and physical abilities of the child, or frequent attempts with positive reinforcement. What are we thinking? Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. You, it says, I take my NCLEX tomorrow. Hey, get off my live. You don't need to be on this live looking at these questions, making yourself more nervous. You need to be trying to relax as much as possible. So you, with the question mark, either you got 2 things. You leave the live willingly, or I ban you. Which one you want? And by ban you, I mean kick you off just until you pass. All right. I say that out of nothing but love and support. Okay, so you need to go and you need to relax as much as possible. All right. And then come back on Wednesday and let us know how you did. All right. That's from me to you. All right. I'm not a nurse. I'm a child care. And this is a great question. I'm glad that you're here. Is it user 16? All right. Appreciate you. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C, the overall mental and physical abilities of the child. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factor. That is part of health promotions and maintenance. That is 6 to 12% on the NCLEX. Lower section on the NCLEX, however, still very important nonetheless. I just started nursing school. I'm in fundamentals. Isn't a good live. Are you asking, is this a good life for you? Absolutely. Because questions are still questions because you'd be so surprised on when these would pop up for you somewhere else. LPN, need to get back for RN. Hey, put that work in. Make that shit happen. Make it happen. The only person that can make it happen is you. I promise you. Okay. Here we go. Question number 3. A parent calls the pediatric clinic and is frantic about a bottle of cleaning fluid her child drank for 20 minutes. Lord have mercy. Which of the following is the most important instruction the nurse can give the parent? Is it A, this too shall pass? Okay, take the child immediately to the ER, contact poison control quickly, or give the child syrup of Epicac. What are we thinking? What are we thinking? Hey, we're doing questions on NCLEX for LPNs and RNs as well. Got these questions off nurseslabs.com. Make sure you guys go over there and check that out for yourself. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, cool. What you doing here hanging out with us? What you doing here hanging out with us? All right, 10 seconds, y'all. 10 seconds. C, B. Got some B's, got some C's. Okay. 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 Hey, key word in that sentence. Which of the following is the most important? Is the most important, okay? All right, here we go. Here we go, y'all. Here's our answer in 3, 2. Just got your acceptance letter. Shout out to you, Ronnie. And the answer is contact poison control quickly. Poison control will have an exact plan of action for this child. So if anytime you have a patient that swallows any type of issue, any type of anything, chemical cleaner or whatever, call the poison control because they will tell you exactly what to do while you're on your way to the emergency room, right? While you're on your way to your emergency room. But you got to call poison control because I can tell you right now, as soon as you get to the emergency room, they are going to do the same exact thing. They're going to call poison control. Be like, what did they drink? Oh, okay, well, let's call poison control so we can find out. Better off that you do it on the way to the ER, right? Here we go. Question number 4. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Is it gluteus maximus, gluteus minimus, vastus lateralis, or vastus medialis? What are we thinking? What are we thinking? What are we thinking? All right, we got a bunch of C's. Hey, appreciate everybody jumping in here. We're doing NCLEX questions. Look, I got these questions off nurseslabs.com. Y'all, these are free questions, Free, not Kevin questions, Kevin. All right, free questions. Go over there and check them out for yourself. Make sure you guys like, share, follow. Hey, we need at least 10,000 likes. Hey, we're already on question 4. You know what I'm saying? We need 10,000 likes. C in the thigh. Okay. All right. Hey, also, I'm going to be putting together a group study session, which I like to call making shit happen, in the month of January for NCLEX. Hey, if anybody be interested in that? Is this for RN or LPN? These are for both RN and LPN. All right, y'all, here we go. Here's our answer, y'all. Here is our answer in 3, 2. I see you, Queen. I'm super interested. Okay. All right, Jolie, I see you. Here we go. And our answer is C, vastus lateralis. Medications are injected into the bulkiest part of the vastus lateralis thigh muscle, which is the junction of the upper and mid third of this muscle. That is part of pharmacological and parenteral therapies because of where we're going to give this IM injection. Okay. So shout out to everybody that got this question right. Hey, we are moving along, ladies and gentlemen. 20-year LPN internal medicine. Shout out to you. Is it Shacky Lime? Shacky Lime Jolie RN. Okay. Yes, me too in January. Okay. Hey, I'm just trying to get a census for it because I'm going to start sending some stuff out. So I want to know, hey, I don't want to go out there and try to waste my time and do it and nobody's interested. You know what I mean? Here we go. Question number 5. A nurse has just started her rounds delivering medications. A new patient on her rounds is a 4-year-old who is nonverbal. The child does not have any identification on what should the nurse do. Is it A, contact the provider? B, ask the child to write their name on paper. C, ask a coworker about the identification of the child. Or D, ask the father who is in the room with the child, or in the room, the child's name. Here we go. Still in nursing school and starting clinicals after January. Shout out to you, Sean. Okay. Here we go. Appreciate all the likes and shares. Make sure you guys smash that like button. Hey, we're on the road to 10,000 likes right now. That's the first tier. All right. We need 10,000 likes. Make sure you guys share. Make sure you guys follow. All right. We are doing these NCLEX questions. Got them off nurseslabs.com. I want to know who you are, where you're from, and where you are at in your nursing journey. All right. And if you're not a nurse, who are you and what you doing here hanging out with us? All right, y'all. Here's our answer. In 3, 2, And the answer is D. Ask the father who is in the room the child's name. In this case, you can determine the name of the child by the father's statement. You should not withhold the medication from the child after identification. That is part of safety and infection control. I need to know who this patient is to make sure I'm giving this patient the right medication. Last thing I want to do is give the patient the wrong medication and then they end up, coding or doing something super crazy that may happen to them. All right. So just apply for nursing school. I hope to get in. Hey, Drew, how about we change our verbiage and say, I just applied for nursing school. I know I'm going to get in. How about we change our verbiage? Hey, come over here with that positivity. Hey, real quick, shout out to everybody up in here rocking with me. Hey, we're doing NCLEX questions for RNs and LPNs. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys participate. Participation is the key, baby. I'm kind of funny sometimes. Today is Monday, so I'm a little slow, but we're about to make some shit happen. You know what I mean? Make sure you guys share, follow, give me all them likes because mostly you're not selfish. But most of you motherfuckers are, but that's okay. But I still love y'all, but don't be selfish your whole life, all right? Hey, if you come into my chat and you act a fool or if you rush me, I promise you, I'm going to ban you. And I enjoy it. I'm petty and I will talk shit about you at the end of it, okay? So don't be rude and don't come in here and be rude to nobody else or rush anybody in the chat, okay? 7-day NCLEX course. That is an NCLEX course that I created for both RNs and LPNs. That is on Black Friday, Cyber Monday deal. Lifetime, $97. Everybody that buys it today will get my... for free, we'll get the 7-day NCLEX or the NCLEX Victory Guide, sorry. And I will include that with it. That's usually $29, but that's going in there for everybody that decides to get it today. Also, if you need coaching, one-on-one coaching for NCLEX, you guys can check that out. Those links are in my bio. Check that out right up there. All right. Violet failed the NCLEX twice. Scheduled to take it again in December. That's what I'm talking about, Violet. Get out there and make that shit happen. That's what I'm talking about. Question number 6. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism, right? The nurse checking the patient's lab results would expect which of the following changes in laboratory findings. Is it elevated serum calcium? Is it a low serum parathyroid hormone? Elevated serum vitamin D or low urine calcium? What are we thinking? Man, I had 1,000 people in here. And the moment I say something about, hey, look at my course, they're just like, nah, fuck you, bro. Hey, make sure you guys smash that like button. Hey, on the road to 10,000. Got these questions off nurseslabs.com. If you guys are just joining us, these questions are both for RN and LPN. Okay. Here's one thing I want for you guys to realize is that the biggest difference between an RN and an LPN is LPNs need to know what they can and cannot do, what they can and cannot accept. That's the biggest difference, okay? The content that you learn, it is still the same that an RN would learn. I promise you. I promise you, all right? I'm in finance, but I guess A. All right, Taylor, cool. I'd rather you have a 25% chance of getting it right than not getting it right if you don't answer at all. So think about it like that. Here we go, y'all. Here's our answer. Hyper means more. Does it, Aurora? Does it? Here we go. And 3, 2, and the answer is A, elevated serum calcium. The parathyroid gland regulates the calcium level in the blood. In hyperparathyroidism, the serum calcium level will be elevated. The chronic excessive reabsorption of calcium from bone caused by excessive parathyroid hormone can result in osteopenia. All right. That is part of reduction of risk potential. Okay. A, and I'm an MA. That's cool. Shout out to you. All right. That's part of a reduction of risk potential. That is 9 to 12% on the NCLEX. A little lower on the level of in regards to questions, but still very important. Those smaller sections can really push you over the edge for you to do well on your NCLEX exam. OK, so here we go. Question number 7. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? Is it a diet high in grain, a diet with adequate caloric intake, a high protein diet, or a restricted sodium diet? What are we thinking? All right. Hey, if you guys are new here, welcome, welcome. Hey, we just hit 10,000 likes, so we're on the road to 20,000 likes. Hey, get carpal tunnel for me. Get carpal tunnel for me and stop playing games, okay? Hey, if you guys are new here, welcome. Hey, we got these questions off nurseslabs.com. I want you guys to go over there and check those questions out for yourself. Also, if you are a brand new nurse and you're about to start school, hey, nursing care plans, NANDAs, all that good stuff, nursinglab.com has as well. Also, I use them when I was in school as well for those care plans because trust me when I tell you, them care plans are a monster. They suck, but hey, We all got to learn, right? We all got to learn. So make sure you guys go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Trying to get away from care plans? Care plans are the worst. They really are. Who said that they're trying to get away with care plans? It said they're trying to get away from care plans now. Well, hey, until they get away with care plans, that ass is still doing a care plan. So you better make it happen, all right? Here we go, y'all. Here's our answer in 3, 2. Sandy, you're not a nurse? That's okay. What do you do, Sandy? Any good tips for NCLEX? Stay in my life. And the answer is a restricted sodium diet, all right? A patient with Addison's disease requires regular dietary sodium to prevent excess fluid loss. Patients should eat an unrestricted diet. Those with primary adrenal insufficiency, also known as Addison's disease, should have ample access to salt because of the salt wasting that occurs in their condition, or if their condition is untreated. Infants with primary adrenal insufficiency often need 2 to 4 grams of sodium chloride per day. That is part of basic care and comfort. 6 to 12% on the NCLEX exam, y'all. 6 to 12% on the lower end. Okay, but still, hey, basic care and comfort is something that you learn within your first semester of nursing school. Okay, so these are those things that you cannot forget. The NCLEX, all that is just it's a circle round. Hey, everything you learn from beginning of school all the way to the end of school, all accumulated together. Okay. Here we go. Question number 8. Crystal, you start school January 24th. Shout out to you. Here we go. Question number 8. A patient with a history of diabetes mellitus is on the second post-operative day following a cholecystectomy, right? She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is the most likely explanation for the patient's symptoms? Is it anesthesia reaction, hyperglycemia, hypoglycemia, or diabetic ketoacidosis? Hold on, y'all. Hold on. Hey, if you guys see people that say their names say like private or anything like that, that's them trying to sell me nudies. We don't sell nudies here. We get them for free because that's what the internet's for. So just like, I know, you know what I'm saying? Don't be coming in here being weird. All right, y'all. What are we thinking? I'll give y'all 10 seconds. You work in vet med. Okay. Shout out to y'all. Hey, we're on the road to 20,000 likes. Hey, these likes have been crazy and I appreciate everybody. The more likes, the more you share, the more it gets out to people. All right. The more it gets out to people. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is hypoglycemia. A post-operative diabetic patient who is unable to eat is likely to be suffering from hypoglycemia. Confusion and shakiness are common symptoms. Reduction in cerebral glucose availability can manifest as confusion, difficulty with concentration, irritability, hallucinations, focal impairments, and eventually coma and death. That is part of physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the 3rd largest section on the NCLEX. Remember, you need content, Q&A with rationales. That's the trifecta that you need, all right? There are no tricks to doing this NCLEX. The only trick is that a motherfucker be lying to you, okay? That's it. Why is the screen black? The screen's not black. You might have to back out and then come back in because some other people have had that problem too. All right, here we go. On to the next one. All right, here we go. Question number 9. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increased abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? Is it bowel perforation, viral gastroenteritis? Is it colon cancer or diverticulitis? What are we thinking? Hey, congratulations to all those that have gotten into nursing school, passed their NCLEX. I appreciate y'all. I love y'all. I don't care if nobody's ever told y'all that, but I'm going to tell y'all that today. So congratulations to y'all for putting in that work. Keep putting in that work. All right. Also, if you guys are new here, welcome. We're doing NCLEX questions. Got these questions off nurseslabs.com. Hey, we are on the road to 20,000 likes. So make sure y'all are out there getting carpal tunnel for me. Somebody said common sense. No, it's not common sense, because if it was common sense, I wouldn't be getting all these questions. I need one-on-one for my NCLEX. Queen, you already know where to find me. Hey, go to my link up here. You already know where to find me. All right. If you need one-on-one coaching, hey, check that link out. The link is in my bio. Okay. Hey, so whoever's coming here making a comment saying that it's common sense, like I said, not common sense at all. What about Mark Klimick? Mark Klimick is great. I love Mark Klimick. That dude's old as shit, but that man got so much knowledge. It's amazing. All right. Lawsuit for what? And here's our answer. Our answer is A, bowel perforation. Bowel perforation is the most serious complication of fiber optic colonoscopy. Important signs include progressive abdominal pain, fever, chills, and tachycardia, which indicate advanced peritonitis. One of the most serious complications of colonoscopies is endoscopic perforation of the colon, which has been reported as being 0.03% and 0.7%. Although coloscopic perforation occurs rarely, it can be associated with high mortality and morbidity rates, right? That is reduction of risk potential, right? Smaller section on the NCLEX, 6 to 9 to 12% on the NCLEX exam, okay? Just letting y'all know the things that get me on the NCLEX exam are the wording. Trust me, the things that get you are not the only one that happens to. Trust and believe me. Do you offer one-on-one for NCLEX PN? Yes, I do, 100%. So I coach for both RN and LPN NCLEX exams, okay? And that link is in my bio on my main little bio page. Okay, here we go. Question number 10. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. Is it the partial thromboplastin time, the prothrombin time, platelet count, or hemoglobin, or all of them, or some of them? Which one? So I need answers. Let's see. Remember, hey, this is a select all that apply. Okay. So, hey, if you guys are new here, welcome. Make sure you guys keep smashing that like button. Hey, we are on the road to 20,000 likes and we're almost there. Get carpal tunnel for me. Mostly because you love me. Oh my God. If you guys are new here, welcome. I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, cool. What you doing here? What you doing here hanging out with a bunch of nurses and soon to be nurses? All A, B, C, D. Okay, Queen, I see you. I see you out there. I see you. All Hamilton. Okay. Medical coder. Shout out to you, Justine. The limit does not exist. No, okay. Oklahoma. Ew. I mean, shout out to Oklahoma, I guess. I finished my LPN Friday. Okay. Working a lab. I'm just here to learn. I'm glad you're here to learn. Hey, it's always good to learn, right? Is this info useful for PA and MD? Probably, but y'all go way more in depth. Do you do private tutoring? I do. Go check the link out in my bio. Okay. Here we go, y'all. South Carolinian, whatever. South Kakalaki. Here we go, y'all. Here's our answer in 3, 2. And the answer are A, B, and C. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. That is part of reduction of risk potential. Okay. Remember, that is 9 to 12% on the NCLEX. Okay. Smaller section, but still very important. All right. Hey, real quick, we are doing questions for both RNs and LPNs for the NCLEX. Make sure you guys participate. Give me all them follows. Give me them shares. Give me them likes. Yo, we're on the road to 30,000 likes. All right. So don't be selfish. Give them to me. Because when you give them to me, other people come here and they give it to me as well. You know what I'm saying? Pause. But y'all know what the deal is. Hey, don't be selfish your whole life. All right. Hey, if you come to my chat and you act a fool, I promise you I'm going to ban you and I'm going to talk shit about you at the end. Don't be rude. That's like coming into somebody's house and telling them what you gonna do in their house. Go away if you're gonna be that way. Nurseslabs.com is where I got these questions from. Okay, make sure you guys go over there and check those out for yourself. The 7-day NCLEX course, y'all. That is the course that I created. That link is also in my bio right now. It's going for $97 for everybody that purchases it. You get the NCLEX Victory Guide, which is $29. I throw that in there for free. So make sure you guys go over there and check that out. That's going to end tonight at midnight. Okay. Also, if you're looking for one-on-one tutoring, that link is in my bio as well. Okay. Make sure you guys go over there and check that out. And also, we're going to do an Ask Me Anything at the end of these questions. Okay. Here we go. Question number 11. A nurse is assessing a client, a nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Is it A, sexual contact with an infected person or partner? Is it B, contaminated food? C, blood transfusion? Or D, illegal drug use? What are we thinking? What are we thinking? Hey, some people may not know this. Some people do. You know, like I said, it just depends on where you are in your nursing journey. Anesthesia student trying to figure out just what in the beep I was thinking. About being anesthesia. Yeah, I bet. I bet. Hey, I can tell you right now, once you get through anesthesia school, though, you're going to be all right. Trust and believe. Trust and believe it. I'll give y'all 10 more seconds. You're a new grad. Shout out to you, Josie. Hey, shout out to all my new grads out there. Hey, y'all, I've been a nurse for 3.5 years. You know, I worked in ICU, I've worked PACU, and I've worked OR. So I know exactly how you feel in that new grad, that imposter syndrome. I know all about it. All right. So, hey, trust and believe me when I'm telling you right now. You're going to make it. And somebody just said that they're trying to pass. How about you tell me that you will pass? Don't tell me that you're trying to do nothing. Tell me that you will pass it. All right. Put it into existence and it shall be so. All right. And the answer is B, contaminated food. Hepatitis A is the only type that is transmitted by the fecal oral route through contaminated food. Yes, the nasties that don't wash their hands with dookies on it. OK. HIV is a single strand positive sense linear RNA enterovirus of the Pictoviridae family. In humans, viral replication depends on the hepatocyte's uptake, and the synthesis and assembly occurs exclusively in the liver cells. Virus acquisition results almost exclusively from ingestion. All right. That is safety and infection control. Wash your hands. OK. Don't be going to places and it be nasty, okay? Wash your hands, all right? There's certain places that, you just shouldn't eat. I will pass my NCLEX. That's what I'm talking about. You will pass that NCLEX. Don't come over here telling me what you hope you're going to do. Don't come over here telling me what you want to do. You better tell me that you are going to do it, all right? Make it happen. Around here, we make shit happen, all right? Question number 12. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? A history of Hep C 5 years previously, cholecystitis requiring cholecystectomy 1 year previously, asymptomatic diverticulosis, or Crohn's disease in remission. What are we thinking? Hey, if you guys are new here, welcome. Hey, we're on the road to 30,000 likes. Hey, we need 30,000 likes. I need for you guys to share, and I need for you guys to follow. That is the trifecta that TikTok wants, and that's what I need in order to keep getting out to folks. So make it happen. Don't be selfish. Get carpal tunnel for me, please. Okay? So shout out to all y'all. If you guys are new here, I want to know who you are, where you're from, where you were at in your nursing journey. Also, I got these questions off nurseslabs.com. Nurseslabs.com. Not only do they have questions, but they also have care plans, NANDAs, all that good stuff for you brand new nurses. All right. So make sure you guys go over there and check those out for yourself. All right. Here we go. My fingers hurt. Look, you better put the phone on the ground and start tapping with your toes. You know what I'm saying? You better make it happen. I got you. NYC Search Tech student. Shout out to my Search Techs out there. Here we go. And our answer is A history of Hep C 5 years previously. Hepatitis C is a viral infection transmitted through bodily fluids such as blood, causing inflammation of the liver. Patients with Hep C may not donate blood for transmission due to the high risk of infection in the recipient. That is part of safety and infection control. Camille, I know you're going to pass that NCLEX. I know it. Trust and believe me. Camille, I see you here all the time. All right. Hey, also, I used to be a Search Tech instructor, right? I was a Search Tech instructor for 3.5 years, clinical coordinator for all that. I'm a trauma nurse instructor now. Trust me, I know all about what y'all are going through, all right? I will pass third. That's what I'm talking about. Hey, I took NCLEX 4 times, y'all. I failed it 3 times, passed on the 4th. I know exactly how you feel. Sabrina, thank you for the universal heart. Girl, that's what I'm talking about. Yes, you know what I'm saying? Appreciate you. Here we go. Question 13. A physician has diagnosed acute gastritis in a clinical patient. Which of the following medications would be contraindicated for this patient? Contraindicated meaning what? Right? Is it naproxen? Sodium carbonate? Is it clarithromycin or furosemide? What are we thinking? NSAIDs. Okay. All right. What are we thinking? Okay, Faye, I see you. I see you out there. Got some D's. Brooke said D. Trippier said A, I think. I'm in my first semester of nursing school, only 4 semesters left. That's right. Count them down. Like, get you a calendar. It's like being in prison. I don't know what that's like, but I can only assume. Hold on, y'all. I already had to ban 2 people because they're bots, and bots are dumb. All right, y'all. What are we thinking? I'm gonna give you guys 10 more seconds. I did my exam about gastritis. That's what I'm talking about. It happens fast. Yep, sure does. I'm telling you right now. Before you know it, you're gonna be on the floor taking care of a patient with freaking with imposter syndrome. Trust and believe me when I tell you. All right, y'all, here's our answer in 3, 2. And the answer is naproxen sodium. Naproxen, who said NSAID? Who said NSAID down there, right? Naproxen sodium is a nonsteroidal anti-inflammatory drug that can cause inflammation of the upper GI tract. For this reason, it is contraindicated in a patient with gastritis. Naproxen is used to relieve pain from various conditions such as headaches, muscle aches, tendinitis, dental pain, and menstrual cramps. It also reduces pain, swelling, and joint stiffness caused by arthritis, bursitis, and gout attacks. Okay, that is part of pharmacological and parenteral therapies. I had to put it up here because there was so much to put in there, right? Pharmacological and parenteral therapies. Listen, that is the second largest section on the NCLEX for both RNs and LPNs. Okay, it is the second largest section. All right, of the NCLEX. Be aware of that. That's why pharmacology is so important, y'all. So important, right? Management of care, pharmacology, and physiological adaptation are the three largest sections, making up 44 to 49% of the entire exam. All right, so you get those three sections down. Look, you Gucci out here. You know what I'm saying? You Gucci. All right, here we go. Question number 14. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? The patient must maintain a low-calorie diet. The patient must maintain a high-protein, low-carbohydrate diet. The patient should limit sweets and sugary drinks. The patient should limit fatty foods. What are we thinking? Hey, if you guys are new here, welcome. Hey, we're almost to 30,000 likes. We're almost to 30,000 likes. You guys make it happen. Make it happen. Also, if you're new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Make sure you guys go over there and check those out for yourself. If you guys are new here, welcome. My name is Kevin. Hey, I failed the NCLEX 3 times, y'all. I failed the NCLEX 3 times. I've been a nurse for 3.5 years. Nobody knows that until I tell them. And they're like, what? You know what I'm saying? Because that exam doesn't determine what type of nurse that you're going to be. Only you can do that. You want to be a shitbag when you're out there as a nurse? Cool, go do that. Right? But if you want to be a good nurse, learn from the failures and learn from the mistakes. Starting with school, starting with your exams, starting with the NCLEX. All right? I'm telling you right now, no job is going to fucking care that you failed your exam. Consult the dietitian. Stop it, Amy. Here we go. Here's our answer in 3, 2. And the answer is D. The patient should limit fatty foods. Cholecystitis, inflammation of the gallbladder, is most commonly caused by the presence of gallstones, which may block bile from entering the intestines. Patients should decrease dietary fat by limiting foods like fatty meats, fried foods, and creamy desserts to avoid irritation of the gallbladder. That is health promotions and maintenance, 6 to 12% on the NCLEX. Listen, let me tell you, I know nobody want to give up the chicken or the McDonald's. No, give up the McDonald's. That shit's nasty. But I know you don't want to give up all the good stuff. But hey, you eat that shit a lot, that gallbladder coming out. Hey, listen, I live in Texas, specifically South Texas. And let me tell you, they love their food down here. The greasiness, the chorizo and egg, baby. Trust me, I understand. These gallbladders be coming out. Trust and believe me, okay? Here we go. Question 15. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Shout out to Dallas. Boycott McDonald's. Yeah, just like boycott Black Friday, right? Which of the following symptoms should the nurse expect the client to exhibit? Is it slow, deep respirations, stridor, bradycardia, or air hunger? What are we looking at? Shout out to all 800, 900 of y'all in here listening to me run my mouth. We're going over NCLEX questions, both for RNs and LPNs. Got these questions off nurselabs.com. Make sure you guys go over there and check those out for yourself. Hey, we're on the road to 40,000 likes. 40,000 likes. I need for y'all to get carpal tunnel for me. Hey, start smashing it with your toe, or go get your infant or your toddler and just have them start tapping. You know what I'm saying? Just start tapping. That's what we want, all right? And if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what you doing here hanging out with us? All right, y'all, here we go. Here's our answer. In 3, 2. And the answer is air hunger. It is air hunger. That is part of physiological adaptation, y'all. Remember, third largest section on the NCLEX, 11 to 17%. Patients with pulmonary edema experience air hunger, anxiety, and agitation. Symptoms may also include coughing up blood or bloody froth, right? Difficulty breathing when lying down, feeling of air hunger or drowning, right? Where else are we at? Feeling of air hunger or drowning. This feeling is called paroxysmal nocturnal dyspnea. If it causes you to wake up 1 to 2 hours after falling asleep and struggling to catch your breath. Okay, this is new. Hey, air hunger, that ain't new, but this question is a little new. This is a little new, especially if you guys been coming here hanging out with me for a little bit. Okay, hey, Physiological adaptation. Just know where we are with that. Hey, real quick, commercial break. Don't y'all go nowhere. Y'all better stay here. I know y'all be trying to leave when y'all be getting some good shit and y'all be wanting to leave. You know what I'm saying? Hey, we're doing NCLEX questions. All right. RNs and LPNs. You guys can find these at nurseslabs.com. Okay. Hey, participate. Smash that like button. Follow, share, do it all. All that stuff helps the TikTok algorithm. Also, it helps me. And also, it helps get it out there to other people that may need it. All right. You never know who needs it. So don't be selfish your whole life. Also, you come into my chat and you act a fool. You try to sell me your nudies. You try to tell me how to run my chat. I'm going to ban that ass. So don't be rude. All right. Also, 7-day NCLEX course. Like I said, $97. You get it for a lifetime. You get all the updates. I have a new generation NCLEX review in there, y'all. And you get it for a lifetime. No subscription, no nothing like that. You get all the updates. Plus, everybody that gets it now will get the NCLEX Victory Guide. It's usually $29, but I'm going to throw that in there for you guys, okay? Also, if you're looking for one-on-one tutoring, that link is also in my bio, thebootnurse.com/coaching. Make sure you guys check that out. And we're also going to do an Ask Me Anything at the end of this live, okay? What about refresher courses for seasoned nurses? Man, sand dunes. I don't do that, but you know, that who's to say that that's not going to come in the future? I like where your head's at, though. May we all pass the NCLEX. It ain't may. It's like we will all pass the NCLEX. Hey, change the verbiage. Change the verbiage. Hey, if you come in here with your verbiage saying I may, I want to, I might, hey, I'm going to tell you, hey, you better say I will, I know I am. You're like, you better change it. You better change it. All right. And you better check yourself. All right, here we go. Question 16. A nurse caring for several patients in the cardiac unit is told that one is scheduled for implantation of an automatic internal cardioverter defibrillator. Oh my God. Which of the following patients is most likely to have this procedure? A patient admitted for myocardial infarction without cardiac muscle damage, a post-operative coronary bypass patient recovering on schedule, a patient with a history of ventricular tachycardia and syncopal episodes, or a patient with a history of atrial tachycardia and fatigue. All right, so what are we thinking? What are we thinking? Shout out to everybody that's just joined us. We are doing NCLEX questions. Got them off nurseslabs.com for both RN and PNs. You guys can look at those. They are free. Also, they do care plans. Check those out for yourself. We're on the road to 50,000 likes. 50,000 likes, y'all. Get carpal tunnel for me. Get carpal tunnel for me. Make it happen. Also, I want to know who you are, where you're from, where you're at in your nursing journey. The whole crowd wants to know. 10 seconds, y'all. 10 seconds. Well, I finally made it to nursing and to medical what? Or medical TikTok. I just want to say, yay. Is it Ileana? Shout out to you. Shout out to you for making it here. Shout out to Brooklyn. Marcy Projects. I don't know nothing about Marcy Projects. I heard it off the Chappelle Show. Please don't come for me. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. 35 years and now retired. Hey, shout out to you. Shout out to you. I'm 36. No idea how that makes you feel. I'm just going to lay that out there. Your correct answer is C, a patient with a history of ventricular tachycardia and syncopal episodes. A automatic internal cardioverter defibrillator delivers an electric shock to the heart to terminate episodes of ventricular tachycardia and ventricular fibrillation. This is necessary for a patient with significant ventricular symptoms such as tachycardia resulting in syncope. That is part of reduction of risk potential, right? 6 to 9 to 12%. We'll say 9 to 12%. All right, 9 to 12% on the NCLEX. One of the smaller sections, but very, very important. All right, that right there, that section right there can set you over. That can set you over. What will be the benefits for ventricular versus atrial? Well, I don't know. Because if you're having you're only going to get a cardioverter defibrillator if you're having a ventricular episode or issue, right? So here we go. Hold on. Hold on, y'all. I got to ban somebody. Y'all already know the deal. They're trying to sell me nudies again. Oh my God. Do you have it? Yes, I do have a YouTube channel. The YouTube channel is The Boot Nurse. That link is also in my bio. All my links are in the bio. Just click on the link tree and all of them are right there for you, okay? I'm Filipino. Shout out to you. Shout out to the Philippines. Question number 17. A patient is scheduled for a MRI scan for suspected lung cancer. Which of the following is a contraindication? Keyword, contraindication to the study for this patient. The patient is allergic to shellfish, has a pacemaker, suffers for claustrophobia, or takes antipsychotic medications. What are we thinking? Shout out to everybody that's just now joining. We are doing NCLEX questions. Got them off nurseslabs.com. You're amazing for this. Hey, I do this. I used to do it Monday, Wednesday, Friday, but everybody literally would DM me and be like, hey, can you do this every day? And I'm just like, all right, well, let's see what we can do. Let's see what we can do. All right. Let me give y'all 10 seconds. 10 seconds. I enjoy doing this. I love doing this. I like essentially meeting new people and conversing with new folks. So I'm glad that everybody's here. But like, make sure you guys share. Make sure you guys follow. Hey, we're on the road to 50,000 likes. All right. I need 50,000 likes. And I also want to know who you are and where you're from and where you are at in your nursing journey. Not fair question. Says you. Here we go, y'all. Here's our answer in 3, 2. And the answer is B. The patient has a pacemaker. The implanted pacemaker will interfere with the magnetic field of the MRI scanner and may be deactivated by them. Patients with cardiac implantable electric devices are at risk for inappropriate device therapy, device heating, or movement, and arrhythmia during an MRI. This patient must be scheduled in a CIED blocked slot or scheduled for an electrophysiology nurse or technician support. But nowadays, MRIs are conditional cardiac implantable electric devices are widely available. Wow, that was a mouthful. And I don't know why it was so difficult for me to say that. Reduction of risk potential, right? We want to be able to bring those things to the light saying like, hey, do you have a pacemaker? Because if we put you through an MRI and you don't tell us you have a pacemaker, you're going to have a problem. So we want to reduce the risks, potentially those risks that may come with that. Okay. All right, here we go. Question number 50K. That's what I'm talking about. Hey, I appreciate y'all. Here we go. Question number 18. A nurse calls a physician with the concern that the patient has developed a pulmonary embolism. Which of the following symptoms has the nurse most likely observed? The patient is somnolent the patient is somnolent with decreased response to the family. The patient suddenly complains of chest pain and shortness of breath. The patient has developed a wet cough and the nurse hears crackles on auscultation of both lungs. Or the patient has a fever, chills, and loss of appetite. What are we thinking? If you guys are new here, welcome. Hey, we're on the road to 60,000 likes because, the more you smash that like button, the more questions that you get. I'm holding these motherfuckers hostage, baby. You already know what the deal is. All right. If you guys are new here, welcome. I am so sorry. If you guys are new, welcome. All right. We're doing NCLEX questions. Got them off nurseslabs.com. I've been a nurse for 6 years. Prison nursing is what? For all of them. And it's great. Hey, some people just, prison may not be good for everybody. Don't matter what side of the wall you on. You know what I mean? I'm just saying. Hey, also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, cool. What you doing here, hanging out with us. Hey, also, I do one-on-one coaching for NCLEX. That link is in my bio. So, hey, I've coached dozens and dozens of folks. The last person I helped actually coach, she just became an LPN. So she's been an LPN all of 2 weeks and out there living her best life. So I'm just saying. Here we go, y'all. Here we go. Jersey, and you're a senior. All right. Here we go. Here's our answer in 3, 2. You graduated in December. Okay, that's what I'm talking about. Wait, what happened? I don't know what happened. All right, there we go. And the answer is B. The patient suddenly complains of chest pain and shortness of breath. Typical symptoms of pulmonary embolism include chest pain, shortness of breath, and severe anxiety. Trust and believe me, the first time you see somebody throw a PE, you will never, ever forget it. The physician should be notified immediately. Clinical signs and symptoms for pulmonary embolism are non-specific. Therefore, patients suspect of having a pulmonary embolism because of unexplained dyspnea, tachypnea, or chest pain, or the presence of risk factors for pulmonary embolism. Must undergo diagnostic tests until the diagnosis is ascertained or eliminated, or an alternative diagnosis is confirmed. That is part of physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Hey, you guys can't see how white this portion is. But I'm telling you, when you have somebody who has a clot and it goes through heart into lungs and you hear, trust and believe me, you will never, ever forget that sound, and it will haunt you for the rest of your fucking days. OK, so if you see a patient who is struggling and has anxiety and difficulty breathing out of nowhere, especially like after surgery, trust me, you better be paying attention, because when they throw a PE, it's the last thing that you ever want to see. Had a patient throw a PE, cardiac arrest immediately, and fell on me. That's wild. That's crazy out here. I'm trying to tell y'all got to pay attention. This is how important the NCLEX is. It's a rite of passage. Remember, this test keeps people out. All right. And if you are truly meant to do it, you will fucking pass that exam. Trust me. All right. Here we go. Question 19. A patient comes to the emergency department with abdominal pain. Workup reveals the presence of a rapidly enlarged abdominal aortic aneurysm. Which of the following actions should the nurse expect? The patient will be admitted to the medicine unit for observation and medication. The patient will be admitted to same-day surgery unit for sclerotherapy. The patient will be admitted to the surgical unit and resection will be scheduled, or the patient will be discharged home to follow up with the cardiologist in 24 hours. What are we thinking? Hey, don't take my laughing. Don't. Hey, understand that I'm laughing because some of these questions are funny to me because I'm just like, wow. They're all about meeting other people. Yep. Here we go, y'all. Here we go. What are we thinking? Y'all got me to 60,000 likes, baby. That's what I'm talking about. I appreciate y'all. I appreciate every single person that's in here. If you guys are new here, welcome. We're on the road to 70,000 likes now. 70,000 likes. D is why. Stop it. Stop. That's why. Gabrielle, that's why I was laughing. Oh, my goodness. Hey, we're on the road to 70,000 likes. Got these questions off nurseslabs.com. Make sure you guys go over there and check those out. All right. Also, 7-day NCLEX course. 7-day NCLEX course is going for $97. That link is also in my bio. $97 and you get a ebook of over 700 pages of important information for you guys to know for NCLEX. Okay, I'm not a nurse hanging out with you guys and learning and free knowledge. Facts. I passed my fundamentals HESI today, 100%, baby. Bridget, that's what I'm talking about. That's what I'm talking about. Here we go. And the answer is C. The patient will be admitted to the surgical unit and resection will be scheduled. Trust and believe me, that resection is happening. All right. Think of where your aorta is. Right. And if that thing is bleeding out, trust and believe me, that thing, hey, they're going straight to surgery. A rapidly enlarged abdominal aortic aneurysm is a significant risk of rupture and should be resected as soon as possible. No other appropriate treatment option currently exists. First of all, you try to tell them, hey, come back in 24 hours and we'll see how you're doing. Trust and believe me, they probably ain't coming back. They ain't coming back. All right. Oh, my God. Gabrielle, hey, that was funny. That made me laugh. Legit. All right. It says my mom survived a shredded. Hey, shout out to Chevy. Is it Chevy? Shout out to your mom for surviving that. For real. Any study tips for Kaplan? Use it. I used Kaplan when I used it. So question number 20. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow. A CBC reveals a platelet count of 25,000. Which of the following actions related specifically to the platelet count should be included in the nursing care plan? Is it monitor for fever every 4 hours? Require visitors to wear respiratory masks and protective clothing? Consider transfusion of packed red blood cells? Or check for signs of bleeding, including examination of urine and stool for blood? What are we thinking? Shout out to all 900 of y'all. Hey, right now we are on the road to 70,000 likes. 70,000 likes. Make sure y'all get carpal tunnel for me. And if anybody asked, I won't pay that doctor visit. I'm just letting y'all know. Just let them know that y'all did it for me. And they'll be like, oh, all right, that's cool. That's cool. Hey, I got these questions off nurseslabs.com. Make sure you guys go over there and check that out for yourself. They're free sets of questions, as well as they have care plans and all that other good jazz over there. All right. Also, I want to know who you are, where you're from, where you're at in your nursing journey, because, hey, we all got to start somewhere. And if you're not a nurse, cool. What you doing hanging out here? What you doing hanging out here? Hey, at the end, also, when I do the Ask Me Anything, I'm going to show you guys what the inside of the NCLEX course looks like with all the perks and all the updates and all that stuff that you guys get, okay? Waiting for my exit exam. I know that's right. I like learning. Melissa, I like you being here. Being nosy. Of course you are. I'm just playing. I appreciate you, though. Here we go. Here's our answer, y'all. In 3, 2, not a nurse, but caregiver for my mom. Hey, so you might learn something here. It might be helpful for you. Here we go. Here is our answer. The answer is D. Check for signs of bleeding, including examination of urine and stool for blood, right? A platelet count of 25,000 is severe thrombocytopenia and should prompt the initiation of bleeding precautions, including monitoring urine and stool for evidence of bleeding. That is reduction of risk potential. All right. The reduction of risk potential. Remember, hey, no, this is the great thing about the labs. You need to know what is the normal platelet count. All right. If it's above it, what disease process would it be? If it's below the normal, what is the disease process that it could be? And then what do I need to implement and do as the nurse to keep my patient safe? Okay, here we go. Hey, don't y'all go nowhere real quick. Hey, we're doing NCLEX questions. Got them off nurseslabs.com. These are for RN and LPNs, okay? RN and LPNs. You guys can go over there and look them out. Look them for yourself, all right? Participate, share, follow. Give me all those likes. Don't be selfish your whole life. Hey, if you're trying to sell me nudies or if you're being rude in my chat, I'm going to ban that ass, okay? That's what I call a 600, all right? That equals 10, 600 seconds equals 10 minutes, and that's how long I'm going to ban you. But in reality, I'm going to ban you forever, okay? So, nudies. Hey, also, 7-day NCLEX course. Like I said, you get it for a lifetime for $97, right? That link is in my bio. You guys go over there and check that out. I have a new generation NCLEX review in there. 4 hours of just straight questions and answers for everyone, to include the freaking case study. So you guys can go over there and check that out, all right? Also, that link is right there in that bio, all right? Also, if you're looking for one-on-one coaching, that link is also in my bio as well. All right, here we go. Question number 21. A nurse in the emergency department is observing a 4-year-old child for signs of increased intracranial pressure after a fall from a bicycle, resulting in head trauma. Which of the following signs or symptoms would be cause for concern? Is it a bulging anterior fontanelle? Is it repeated vomiting? Signs of sleepiness at 10 p.m. Or is it inability to read short words from a distance of 18 inches? What are we thinking? What are we thinking? Hey, so we're smashing that like button. Yo, hey, we're smashing that like button and we're sharing, right? We're getting 80,000 likes. I appreciate everybody that is rocking with me. Hey, I'm going to start doing these every day, 5:30. Hey, so set your calendar, get your notifications going on. You know what I'm saying? Hey, tune in because I got a bunch of stuff within the next couple of days and couple of weeks coming down the pipeline that I think would benefit so many of y'all. All right. Even if you are in nursing school, 5:30 Central Standard Time. I'm actually going to put all that on my bio so you guys can see that, okay? It's already there anyway, but I'm going to put that anyway. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is repeated vomiting, right? Increased pressure caused by bleeding or swelling within the skull can cause a delicate brain tissue and may cause become life-threatening. Repeated vomiting can be an early sign of pressure as the vomiting center within the medulla is stimulated. That is part of physiological adaptation, which is the 3rd largest section on NCLEX. Hey, who's in here being rude? Howard Kim 283. Hey, what you say? Hey, I didn't see it. Hey, everybody gets 1 600, right? So if you want to request a 600, best believe you let me know and I'm going to ban somebody's ass if you're up here acting a fool, all right? So if you're in here acting a fool, trust and believe me, don't do it, all right? Here we go. Question number 22. A non-immunized child appears at the clinic with a visible rash, which of the following observations indicates the child may have rubella or measles, all right? So is it A, small blue-white spots are visible on the oral mucosa, the rash begins on the trunk and spreads outward, there is a low-grade fever, or the lesions have a teardrop of a rose petal appearance? What are we thinking? Shout out to all 800 of y'all listening to me run my mouth. Hey, we're doing NCLEX questions. I got them off nurseslabs.com. These are both for registered nurses and licensed practical nurses or vocational nurses, depending on where you're located, all right? Depending on where you're located, make sure you guys go over there and check those questions out on nurseslabs.com, okay? Also, I want to know who you are, where you're from, where you're at in your nursing journey, okay? And if you're not a nurse or on your nursing journey, what do you do? Hey, some of these things are going to be very confusing for you. And if you've never been exposed to these, I implore you to use Google. To use Google, okay? And also, when you guys are studying, remember, Australian CCRN, shout out to you. Who said that? All right, Matt, I see you out there. All right, so also make sure you guys are paying attention, okay? A little Google ain't gonna hurt nobody to look up some research. Trust and believe me. Life is beautiful from Nepal. I don't know. I have this infatuation with people from Nepal, so shout out to y'all. Mount Everest is over there. I'm just saying. Hey, so the answer is A. Small blue-white spots are visible on the oral mucosa, right? Koplik's spots are small blue-white spots visible on the oral mucosa and are characteristics of measles infection, right? Near the end of the prodrome, Koplik's spots appear on the buccal mucosa opposite of the second molar, right? They are generally are first seen 1 to 2 days before the appearance of the rash and last until 2 days after the rash appears. Okay, that one got you? Hey, some people are just like, oh my God, that's easy. Well, some people just don't know. Okay, and this is where you got to really pay attention and recall the information from the content, right? Health promotions and maintenance, right? 9 to 12% on the NCLEX. Okay, Georgia failed my exit exam on my way back. I know that's right. Hey, if you fail an exam, the only thing I want to hear come out of your mouth is saying, I'm going back and I'm taking it again. I don't want to hear somebody say I'm defeated. I don't want to hear somebody saying it's just not for me. Hey, I did all that for you. I did all that for you. So you don't have to. All right. So pick your ass up, dust yourself off, and get to work. All right. Make this shit happen. All right. Here we go. Question 23. Question 23. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? Keyword. The keyword is not correct, which means 3 of these are correct. Which one is not? Scarlet fever is caused by infection with group A streptococcus bacteria. Strawberry tongue is a characteristic sign. Petechiae occurs on the soft palate. The pharynx is red and swollen. What are we thinking? What are we thinking? Hey, we're on the road to 90,000 likes right now. 90,000 likes. Hey, I'm from Texas, y'all. 90,000 likes. That is where we are going. Also, got these questions off nurseslabs.com. They're for RNs and LPNs or LVNs, depending on where you are. And they're free sets of questions. You guys can go over there and check those out on nurseslabs.com. Also, 7-day NCLEX course. If you're graduating here within the next 3 months, within the next month, I got that review on there. 4 hours of a new generation NCLEX review. All right. 4 hours. And I'm going to show you guys what it looks like. It's going for $97 right now. And you're going to get an ebook for free. Ebook for free. It's B. Okay, bye. Okay. Strawberry tongue has multiple pathologies. Okay, well, we're talking about scarlet fever. So is it one for scarlet fever or is it not? All right. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is C. Petechiae occurs on the soft palate. Petechiae on the soft palate is a characteristic of rubella infection, right? That is part of physiological adaptation. 3rd largest section on the NCLEX, going for 11 to 17%, right? Hey, management of care, physiological adaptation, and pharmacology make up 44 to 49% of the entire NCLEX exam, okay? It says, I was going to choose that one, but doubt myself. Never doubt yourself. Go with your first instinct. You're a TAC PEMT in Texas. Shout out to you. Do you need above average on all categories to pass? No, you do not. You do not need above average on all. And you change your answer. Oh, Lord. Hey, don't change your answer. Do not do it. Your first answer is usually the correct answer, all right? Question 24. A child weighing 30 kilograms arrives to the clinic with diffuse itching as a result of an allergic reaction from an insect bite. Diphenhydramine 25 milligrams 3 times a day is prescribed. The correct pediatric dose is 5 milligrams per kilogram per day, which the following best describes the prescribed drug dose. The dose is its correct dose. The dose is too low, it's too high, or the dose should be increased or decreased depending on the symptoms. What are we thinking? This is a little bit of math for y'all. A little bit of math. M-A-F-F. Okay? M-A-F-F. If you guys are new here, we're doing NCLEX questions. A little bit of math. M-A-F-F. All right? Got these questions off nurseslabs.com. Free sets of questions. Go over there and check them out for yourself. All right? Also, hey, smash that like button. I need for you to smash that like button. I need for you to share it. I need for you to follow. Give them all to me. All right? Give them all to me. And when you share it to people who may need it, right? Share it to them even if you know they don't need it. That way they could share it to somebody that they know may need it. All right. Sorry, I'm over here messing stuff up. I'm gonna give y'all 10 seconds, okay? 10 seconds. Also, I want to know who you are, where you're from, where you're at in your nursing journey. It says, I'm sure I had this question on my NCLEX 22 years ago. You probably did. You probably did. All right, y'all, here we go. Here is our answer. Here is our answer in 3, 2. And the answer is B. The dose is too low. This child weighs 30 kilograms, and the pediatric dose of diphenhydramine is 5 milligrams per kilogram per day, which is 5 times 30 equals 150 per day. Therefore, the correct dose is 150 milligrams per day. Divided into 3 doses per day, the child should receive 50 milligrams 3 times a day rather than 25 milligrams 3 times a day. Dosage should not be titrated based on symptoms without consulting a physician. That is pharmacological and parenteral therapies. Dosage calculations. Hey, you may get 1, you may get 2. On the last time I took NCLEX, I got zero dosage calculations. Look, me and math just don't be mathing sometimes. I don't know why we're so intimidated by it, but we are. But best believe, you gotta know it. I'm in my prerequisite Jackie. Jackie, trust and believe me. You better get ready. I haven't taken this class yet. Oh, trust and believe me. Yep. Do they have a built-in calculator? No. Oh, yeah, they do have a built-in calculator. You do, which is your hands, fingers, paper. There you go. I'm Miss B word. I'm just letting you know what the deal is. Okay. I love to have lots of dosage calculation. That's my strongest. Hey, I trust and believe me. I know that there's a lot of people that are just some math wizards that just love to do some math. All right. Here we go. Question number 25. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testes in the scrotal sac. Which of the following statements about the undescended testes is the most accurate? Is it A, normally the testes are descended by birth? B, the infant will likely require surgical intervention. The infant probably only has one testes. Or D, normally the testes descends by 1 year of age. What are we thinking? Hey, we are at 90,000 likes. Yo, on the road to 100. Hey, the most likes I've ever gotten have been 101 likes. 101,000 likes. Hey, let's shatter that. We still got a good bunch of questions. All right. So let's get over to 100,000 likes. Make sure you guys share. Make sure you guys follow. I don't know anything about these kids. Look, you better start learning about these kids because you already know how I feel about these kids. Hey, if y'all know how I feel about these kids, go ahead and drop that famous 3-letter acronym down in there. All right. Here we go, y'all. 10 seconds. Appreciate the follows. Thank you guys. Appreciate the follows. Everybody's saying D. We got some B's in here. FTK Christy with the FTK Amanda. Hey, y'all wild out here. Y'all are wild. I appreciate y'all. Y'all are some good sports. Hey, I love my kids, by the way, but dead ass. They're some assholes. Here we go. Here's our answer in 3, 2. What's up, Nate? Or King? I'm sorry. What's up, King? How are you, sir? Here we go. And the answer is D. Normally, the testes descends by 1 year of age. Normally, the testes descends by 1 year of age. In young infants, it is common for the testes to retract into the inguinal canal when the environment is cold or the chemostatic reflex is stimulated. The exam should be done in a warm room with warm hands. It is most likely that both testes are present and will descend by a year. If not, a full assessment will determine the appropriate treatment. This is part of health promotions and maintenance, which is 6 to 12% on the NCLEX. And to answer somebody else's question, the NCLEX is based off of, it is a computer adaptive test, and it is based off of how you answer. If you answer all your questions well, you're going to start getting harder questions. But if you start getting your questions wrong, they're going to start giving you easier questions. The easier the questions that you start to recognize, you might want to stop, take a breath, and be like, all right, I'm doing something wrong, and I need to reevaluate while you are taking your exam, okay? So the goal is to be above in all sections, right? But then there's some of those sections that are heavy hitters, all right? Hey, real quick, we're doing NCLEX questions for nurses, RNs, and LPNs. Make sure you guys participate, share, give me all them likes. Hey, we're on the road to over 100,000 likes, and I appreciate y'all. Don't be selfish your whole life. Give them to me, all right? Hey, you come into my chat and you act up, I'm gonna ban you. I already saw somebody act up down there, and I've already had to ban like 3 or 4 people. I'm petty, and I'm going to talk shit about them later on. All right. Nurseslabs.com is where I got these questions. Right now, the 7-day NCLEX course, y'all, $97 for a lifetime. Okay. It's $97 for a lifetime, and you're going to get an ebook that's $29, and I'm going to give it to you for free. All right. So anybody that gets it between now and between midnight, you'll get the course, plus you'll get an ebook. Also, I do one-on-one tutoring. Anybody looking for one-on-one tutoring for NCLEX, that link is also in my bio. All right. Hold on one second, y'all. Hold on one second. Man, I wish I had a moderator at this point because I got so many nudies that want to come up in here and just drop nudies, man. What you mean? Question number 26. A child is admitted to the hospital with a diagnosis of Willem's tumor stage 2. Which of the following statements most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not expand beyond the kidney and was completely resected. The tumor extended beyond the kidney but was completely resected. The tumor the tumor has spread into the abdominal cavity and cannot be resected. What are we thinking? Jay, thank you for the flames. I appreciate you. Am I on fire? Is that what I'm doing? I don't know. That's okay. Hey, 1800. Hey, I would rather you guess than you not say nothing at all. You have a 25% chance of getting it right than not getting it right at all. And remember, apply what you know versus applying what you don't know. And sometimes when you don't know, I would rather you guess than not answering at all. Okay. We got some B's, we got some C's. I'm gonna give you guys 15 seconds. Also, your likes all-time high. Who said that? Hey, 103 likes. Hey, we're celebrating. We're celebrating today. Celebrating. I appreciate everybody getting me past that. Hey, shatter it. Shatter past them limits. I appreciate y'all. Hey, we're doing NCLEX questions. Got them off nurseslabs.com. Y'all got me past 100,000 likes, and I appreciate y'all. I'm so glad this is helpful for you. Who said that? Who said that? Jade, I'm so glad you think this is helpful for you. All right, here we go, y'all. Here's our answer. Here's our answer. Miss HIV lady, I appreciate the heart, girl. You know I'm feeling you. It says... All right, it says, man, 50,000 likes were from me. You're welcome. Hey, 1800, I appreciate you. I ain't gonna hate on you. I'm just saying, if you don't know, you already know. I say, hey, I would rather you guess. All right. And the answer is C. The tumor extended beyond the kidney, but was completely resected. The staging of Willem's tumor is confirmed at surgery as follows. Stage 1, the tumor is limited to the kidney and completely resected. Stage 2, the tumor extends beyond the kidney but is completely resected. Stage 3, the residual non-homogeneous tumor is confined to the abdomen. Stage 4, homogeneous metastasis has occurred with spread beyond the abdomen. And stage 5, bilateral renal involvement is present at diagnosis. That is part of physiological adaptation. SG or SJ. That's okay if you guessed. Some people just don't know it. And if you don't know it, hey, you don't know what you don't know. And this is why practicing is very, very important. It says, why do all these all right, but I can't pass the damn NCLEX, Kevin? Why? I don't know. Maybe we need to have a sit down conversation and we can talk about that. You already know where to find me. We can we make shit happen. What? You know the deal around here. We make shit happen. Come holler at me. You already know where to find me. Question 25. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Man, that is a tongue twister. Which of the following findings is consistent with this diagnosis? Select all that apply. Do you have a urine-specific gravity of 1.040, a urine output of 350 mLs in 24 hours, brown tea-colored urine, or generalized edema? Remember, this is select all that apply, so I need some, one, or all of them. Select all that apply. You know, your favorite sets of questions. If you guys are new here, welcome. We're doing NCLEX questions. Look, we got past the highest amount of likes that I've ever had. Hey, but we can keep going. Y'all keep smashing that like button. Make sure you guys share. Make sure you guys follow. Nurseslabs.com is where I got these from. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. All right, you got ABD, BC, BCD, C, and D. Okay, Deep says AC. So who said somebody said something within normal limits. I think I missed it. All right, y'all. About to graduate? That's what I'm talking about. Hey, y'all. Hey, graduation is in the next 2 or 3 weeks for a bunch of y'all. So, hey, congratulations to y'all. Congratulations. Here we go, y'all. Here's our answer in 3, 2. And the answer is A, B, and C. Acute glomerulonephritis is characterized by high urine-specific gravity related to oliguria, as well as a dark tea-colored urine caused by large amounts of red blood cells. Hold on a second. Nope. All right. Hey, that is part of a reduction of risk potential. Okay. Remember, hey, here's a great thing about select all apply. If you don't know, don't pick it. Do we get, so yes, you do get partial credit for select all, for SATA questions, right? But here's the thing. If you don't know, do not pick it. So if the answer choice is required, if it's 3, but you only know 2, but you're not sure about the third one, don't pick the third one. If you are not sure, don't pick it. right? But you get partial credit now. Trust me. I wish I would have had that when I took my NCLEX, and I'm telling you, everyone else before the new generation wish they had that too. Question 28: which of the following conditions most likely causes acute glomerulonephritis? Is it A, a congenital condition leading to renal dysfunction? B, prior infection with group A, streptococcus within the past 10 to 14 days? Is it C, viral infection of the glomeruli? Or is it D, nephrotic syndrome? We say in school, when in doubt, choose two and get out. Hey, when in doubt, choose two, get out. But 9 times out of 10, you will know what those two are. It's always that third one. You're going to be like, And if you start doing that, you don't pick it. Because you're going to have a 50-50 chance. Why do 50-50 chance when you already know for a fact what the other two are? And now it's partial credit. Partial credit is saving everybody. It is saving everybody. 10 seconds, y'all. 10 seconds. If you guys are new here, welcome. We're doing NCLEX questions for RNs and LPNs, okay? Got them off nurseslabs.com, all right? Make sure you guys go over there and check that out for yourself. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Also, I have an NCLEX course, ladies and gentlemen, for both RNs and LPNs. It's going for $97. You get it for a lifetime. And by lifetime, I mean your life. I mean, because, our expiration dates are different. I'm just saying, for however long you have it. All right. You guys go over there and check that out. Everybody that gets the course between now and midnight will get a free copy of my ebook. All right. Which I call the NCLEX Victory Guide. Yeah. It says I was just on my test. This was just on my test. Shout out to you, Kimberly. All right. One of my favorite Power Rangers. You know what I'm saying? Anyways, the answer is B. Prior infection with group A streptococcus within the past 10 to 14 days. Acute glomerulonephritis is most commonly caused by the immune response to a prior upper respiratory infection with group A streptococcus. Glomerular inflammation occurs about 10 to 14 days after the infection, resulting in a scant, dark urine and retention of body fluid. Periorbital edema and hypertension are common signs at diagnosis. That is physiological adaptation, which is the third largest section on the NCLEX exam with 11 to 17%. It's a monster, y'all. It's a monster. Acute conditions, trauma conditions, chronic conditions. That is what physiological adaptation is. Okay, just remembering strep A is always messing things up. Yep, strep is always messing something up. All right, here we go. Question 29. An infant with hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but the fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Is it A, massage the groin area twice a day until the fluid is gone? Is it B, referral to a surgeon for repair? Is it C, no treatment is necessary, the fluid is reabsorbing normally? Or D, keeping the infant in a flat supine position until the fluid is gone? Yeah, stop it. Man, that's like a mating call. Everybody sees it, they just repeat it. 1800, you're wrong for that. D is funny, ain't it? Hey, shout out to everybody that's in here rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Also, if you're about to start nursing school, they have really good care plans over there. I don't care if your school's talking about getting rid of them or not. You better go over there and look at them. You better go over there and look at them for yourself. Learn those nursing diagnoses, them things. I'm going to give y'all 10 seconds. Also, make sure you guys smash that like, keep smashing that like button. Make sure you guys share. The more you smash the like button and share and follow, the more that TikTok brings people over here who don't want to be over here, but then also who do want to be over here. Okay. Fluff. What's up, Fluff? Fluff, I don't remember see you come in here. Appreciate the follows. Appreciate all the likes. Appreciate all the love. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is C. No treatment is necessary. The fluid is reabsorbing normally. A hydrocele is a collection of fluid in the scrotum that results from a patent tunica vaginalis. Right? Illumination of the scrotum. Hold on a second. Yeah, illumination of the scrotum with a pocket light demonstrates the clear fluid. In most cases, the fluid reabsorbs within the first few months of life and no treatment is necessary. That is part of health promotions and maintenance. Look, there was so much info here that I had to put it up here in abbreviations, y'all. You know what I'm saying? So there's that. Also, when you guys are studying, you need to study content. questions with answers, and you need to review and read your rationales. There are no tricks to studying for this test. It's called putting in the fucking work. That is the trick. AKA not a trick. So stop trying to go around trying to make it think like this is easy. It's not meant to be easy, because if it was easy, everybody and their mom would do it, right? And then it would water down the entire profession. I'm just keeping it all the way real with y'all, okay? Here we go. Question number 30. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which of the following is the most likely explanation for these symptoms? Is it A, inadequate tissue perfusion leading to nerve damage? Is it B, fluid overload leading to compression of nerve tissue? C, sensation distortion due to psychiatric disturbance? Or D, inflammation of the skin on the hands and feet? What are we thinking? Shout out to all 530 of y'all rocking with me. I appreciate everybody being here. I appreciate all the love, all the shares, all the follows. It does wonders. It does wonders. All right. Hey, keep smashing that like button. All right. I want to know who you are, where you're from, where you're at in your nursing journey. Hey, y'all, I failed my NCLEX 3 times. 3 times, y'all. 3. All right. And let me tell you something right now. No one anywhere cares. No one anywhere cares. All right. So if you have failed your NCLEX, first off, you need to get that performance breakdown, see where you messed up at. Second, get my NCLEX course. Third, come out at your boy for some tutoring. But being totally serious, you need to pick yourself up. Pick yourself up, y'all. All right. Trust and believe me when I tell you. Shout out to ICU, 7 years in Arizona. Okay, Nancy, I see you, girl. Hey, so I've worked ICU. I worked ICU for a little over a year. I worked burn ICU, medical ICU, and a neuro ICU. I worked in PACU as well as working in the OR, right? So, hey, I got a little bit of everything, right? A little bit of everything in regards to that. Here we go. Here's our answer in 3, 2. And the answer is A, inadequate tissue perfusion leading to nerve damage, all right? Patients with peripheral vascular disease often sustain nerve damage as a result of inadequate tissue perfusion. Ischemic rest pain is more worrisome. It refers to pain in the extremities that is due to the combination of PVD and inadequate perfusion. Ischemic rest pain often is exacerbated by poor cardiac output. The condition is often partially or fully relieved by placing the extremities in a dependent position, so the perfusion is enhanced by the effects of gravity. That is part of physiological adaptation. Third largest section on the NCLEX at 11 to 17%. Schedule my NCLEX on Wednesday, literally freaking out. Is it, all right, I'm gonna mess your name up. You, ma'am, don't be freaking out. Don't be freaking out. Tomorrow you need to just chill out, because tomorrow's Tuesday, you're taking it on Wednesday. You need to just chill, all right? But yeah, physiological adaptation, y'all. Physiological adaptation. All right. Here we go. And that, ladies and gentlemen, is the end of our questions today. But hey, you guys hang around. We're going to do an Ask Me Anything. All right. Hey, I appreciate y'all participating. Y'all got me to 115,000 likes, and I can't even tell y'all how awesome that is. All right. I appreciate all the love, all the likes, all that. I had to ban like 6 people. Most of them were bots, but then somebody else came in here and was being rude to somebody else, so I banned them too. So you come here, you be rude, I will ban that ass. And I'm petty over 9,000 Vegeta style, okay? Got these questions off nurseslabs.com. They are free sets of questions. Go over there and check those out for yourself. Also, the 7-day NCLEX course, Black Friday, Cyber Monday, lifetime, you get it for a $97. As a matter of fact, I'm about to show you exactly what it looks like, okay? It's going to expire tonight. Everybody that gets it today will get the ebook, which is the NCLEX Victory Guide, over 700 pages, over like 56 different topics. There's a whole bunch of stuff that's on there. All right. Also, if you're looking for tutoring, I do that as well. I don't know what I'm doing in pharmacology health. Okay, Jackie, I got you. Hey, so I go over pharmacology medications inside of the 7-day NCLEX course, and I'm about to show you right now. Boom. All right. So ladies and gentlemen, this is what the website looks like. Let me back that up. So this is what the website looks like. That's me running my mouth, okay? And it expires soon, okay? So it expires soon, right? So right here, you come onto the website. All you got to do is click the enroll to the 7-day NCLEX course, or you can scroll down. We talk about the NCLEX mindset, the structure, critical thinking, pharmacology, right there. Boom. I have 18 videos in pharmacology right now. Okay. 18 videos. And I'm going to show you that. We talk about management of care, physiological adaptation. Remember, those are the 3 largest sections on the NCLEX, and what to expect on NCLEX day, the day before, the day of, and the day after. And I have the curriculum laid out right here. We click down here. Boom. This is where it takes you. You get it for $97. You get lifetime access. This review you will get when it is uploaded, right? This review is already on here. Right now, there are over 50 videos that are in here, and you guys are going to get all of those, right? And like I said, this is both for RNs and LPNs. But let me show you what it looks like, right? So this is what it looks like. I'm going to show you guys right now. So this is what you get, right? So here is the NCLEX review. Each video is less than 30 minutes, right? Each one is less than 30 minutes. Now, who was it that said that something about pharmacology? Like, look at this right here. Pharmacology in itself. There are 18 videos right here. 18 videos, right? And you get, Jackie, look at that, 18 videos. I'm going to show you a video right now, Jackie, since you said something specific about that, right? Where this is cardiovascular meds, right? And then obviously, let me turn this off because you don't need to hear it, right? So right here, we go over cardiovascular meds. We talk about, here, let me bring this down just a little bit so everybody can see it, right? So that everybody can see that. Yeah, that's better, right? So now you can see this. We go on, do an intro, talk about ACE inhibitors. We talk about the common ACE inhibitors, right? Every ACE inhibitor is a prill. We talk about the signs and symptoms. We talk about if it's an inotropic, chronotropic, dronotropic, right? So talks about all those. We got our ARBs. We go through beta blockers, the mechanism, the purpose, common adverse effects, all that stuff, right? Calcium channel blockers, right? Not every calcium channel blocker, but calcium channel blockers, we remember dipines, like we're dipping in the calcium channel, right? And then also we have verapamil and diltiazem or cardiazem, right? So that's a good way to remember for calcium channel blockers. Go through our statins. We got our anticoagulants, our diuretics, our antiplatelets, digoxin, vasodilators, antiarrhythmic medications like lidocaine and amiodarone, right? And then we talk about the contraindications. We have all those. That's just one video. I have 50 videos and you get all the videos updated, right? So I'm working on filling in my cardiovascular section, as well as I'm working on the 7-day review as we speak. Well, not right now, but you know. And that link is in my bio, right? Once you click that link tree in my bio, the first one, it'll say 7-day NCLEX course, and it will take you to this website right here, right? And it's a Black Friday deal going for $97, right? And you get all this stuff and you get all the updates. Like you get access to a Facebook page. You get all these monthly, bi-weekly to monthly new content that gets updated in there, all that good jazz, right? And then over here, we talk about, welcoming, right? And I tell you my story, why I decided I wanted to do this. What else? We talk about the computer adaptive testing, the new passing standard, right? As well as the NCLEX test plan, how to answer NCLEX style questions, critical thinking, the rules on the NCLEX. Y'all, right here, the new generation NCLEX, right? This is the new generation NCLEX review. Let me show you. All right. So there's over 100 of them on here. I go through the questions. We break the questions down. We go why these questions are incorrect, why they're incorrect, and then why they are correct. And then the ones that everybody always wants to know about are the case studies. There goes the case studies right there. Right? There goes the case studies right there. Me explaining it, reading it to you, and then notice that it says, hey, which item is which? This is you'll get 6 questions per case study, and they will update it as they go along. If you guys just saw that edit right there, my dyslexia, I said a number backwards, but I put an edit in there, And also you get this, and you're going to get everything else that comes with it. So when I update any content, you guys are going to get it. All right. When I update anything that's in this course, you guys are going to get it. So you pay $97 one time. That link is in my bio right there. Also, if it's right here, I'll show you guys right here. That link is also right there. Right, the bootnurse.com/special, right? Or you can find that link in my bio, right? But right here, look, we're going over the case study, and then here's your first case scenario, or here's your first question. Or we go forward, hey, here's your select all that apply. I also talk about the topics, like, hey, what is the topic of this question? Once you understand the topic of the question, then you can kind of paint the picture and recall your content. All right. Remember, studying for NCLEX, there are no tricks involved. It's all about hard work, right? Think about this one. This is your closed one, right? Essentially kind of like the fill in the blank, right? I'm pretty sure that looks familiar, right? We go through, hey, we were talking about air trapping earlier, right? When we were doing questions for all those that remember. So you have not select all apply, but you have your drop down, and then we go through why this answer is the correct answer. Then you have other ones like this, anticipated versus not anticipated. So you get a prescription from the provider for a patient that has COPD. What prescription could I anticipate that I need to follow through as the nurse? You see what I'm saying? And then you'll see me throw up a pause signal like that, telling you to pause because you have accountability, right? Telling you to pause so you can figure out what the answer is. And then we come back and then we go through it together. The reason why it's called the 7-day NCLEX course, y'all, is because I've done so many reviews where they've been over a 3-day period, and I feel like it's so much cramming. All I'm asking you is to give me 2 to 3 hours a day over a 7-day period where you can set aside the time, have some accountability and some time management so we can go through it. That's all I'm asking. I know you got a job. I know you got kids. I know you got a wife. I know you got a husband, or whatever, So all I'm asking is for 2 to 3 hours over a 7-day period for you to sit down and for you to go through it with me. That's it. And then you will understand by the time it's all said and done. Hey, for my NCLEX course right here, y'all, look. I go over, there's 100 questions, not over 100 questions. Look, 99, right? 99, 100 right there. You see what I'm saying? So, and then we go into how to evaluate the process, and then we talk about the study plan, and then, like little memory tricks that are on here, right? Memory tricks, EKGs. I know some people are like, man, the EKGs and pharmacology are the death of me. Hey, just some little things for you guys to remember in regards to with this course. But like I said, you get all of this right now. There are 55 videos in here, if I counted those right, which I'm pretty sure I did. But, me and math don't be mathing like that. But 55 videos that are in there with projections of a whole bunch of other content videos going in there. People have asked me for peds, asked me for safety, asked me for respiratory. Trust me, I have a whole curriculum and it's all going there, but I'm only one person. I can only do so much. All right. So, ladies and gentlemen, that is the description of the course. And like I said, if anybody is interested in it, you guys can check the link up here and that will take you directly there. But hey, how y'all doing? I'm kind of having a weird hair day right now. You know what I'm saying? But welcome. My name is Kevin. I go by the boot nurse. Been a nurse for 3.5 years. I've been in the Navy for 16 years. I know I don't look it, but trust me, the way that this body is feeling, look, I'm just saying, I want in person. Oh, so I don't know what you want in person. Like you want to do like one-on-one type of stuff. If you're looking to do one-on-one coaching, you can check the link in my bio. Watt says, how long is the one-on-one session, Kevin? So the one-on-one sessions are 1 hour plus, right? It all just depends on you. Usually when we do the one-on-ones, I've gone as far as 2.5 hours, but it all just depends on you and what you're understanding. Usually our first session is the longest, Watt. Usually the first session is the longest, but you usually get 1 hour plus. Sunflower says, thank you for your service. I appreciate your support. It's always loved and needed. How long? Weeks. So 30 days. So you get one. So essentially, all this is explained, Watt, if you go up to my to the link in my bio. But essentially, you get 30 days with me. You get 4 one-on-one personal sessions. You also get my phone number. We work on a tracker. We work on a study plan for you. We talk about motivation. We talk about mentorship. We break NCLEX style questions. We break them down together. So like when you go do a quiz and then and it's time that week of like if it's on that Sunday that we're talking, I'm going to be like, all right, now let's look at the questions that you have the most difficulty with, and we are going to break them down together. Or sometimes we'll even start a quiz together and we'll do them together so you can see the flow of how things work. Okay. This is really helpful. I've been appreciating you. I can't wait to start back school. Kayla, hey, I'm glad that this is super helpful for you. Okay. I really am. Or else I wouldn't do this. If there was no benefit, like for anybody else, then I wouldn't do this. You know what I mean? I'm going to hang out for probably like a good 15 minutes, like doing this Ask Me Anything. But what questions do you guys have? What questions do you guys have? Watt, I know you got tons of questions. I'm telling you right now, Watt, you need to go up to that link in my bio and you need to go to the NCLEX one-on-one tutoring. You need to sign up to get to look at the page and all that other good jazz. And then come holler at me. You know the deal. You know the deal. What's up, SJ? I see your hand raised. You, with the hair and the hand. What question do you have? But yeah, like I said, I've been in the Navy for 16 years. I've been an educator going on 8 years. I've been a surgical technology instructor. I did that for 3.5 years. I taught formally on the podium as well as I taught as a clinical instructor. And then I eventually was the clinical coordinator. I then started teaching other courses such as tactical combat casualty care, pre-hospital trauma, advanced burn, as well as I'm a trauma nurse instructor. So I've done a bunch of teaching, and I still teach. And this is how I like to teach, right? This is the best way for me to get my message out to people that want it, who want to hear it, right? I'm a sophomore nursing major and I'm nervous. What advice do you have? Definitely get your time management under control, as well as get into a small group, 3 other people, and split the notes up and study collectively. You do 25% of the work. The other people do 25%. You do it collectively. 25% of the work, you reap 100% of the benefits if you have the right people that are in your group with you. What time does this normally start? I feel like I was late. So 5:30 Central Standard Time. It's also in my bio. I say I start Monday, Wednesday, Friday, Central Standard Time at 17:30. All right. I do military time, but then they also do military time on the nursing floor as well. OK, I want to be a trauma nurse, but I feel like I know nothing. Jackie, if you want to be a trauma nurse, of course, you know nothing. Like you haven't been there yet. You have to go through the stages of going into something new and being a sponge and absorbing all of that information. Like you have to go through those stages. You have to go through imposter syndrome. And then eventually with repetition and having a really good mentor as well in the ER or wherever you're working where there's trauma is you will grow, right? I would not expect you to come right out of school and be like, hey, I know everything. People would fucking hate you. And that's not what you want, right? And don't tell me what you want to do. Tell me that you're going to make it happen. I am going to be a trauma nurse. Say it, Jackie. Say it with me. I love your scrubs. Hey, I appreciate you. Rothware. I like Rothware. I'm not a Fig guy. I'm not a Cherokee guy. Not a fan. I'm on academic probation. I go back in May. I am an RN student. You motivate me to go back. Spicy. Go back. Delayed, but never denied. Delayed, but never denied. Okay. How long should I study each day for nursing classes without overloading my brain? Kayla. On average, you should be studying. It should be like honestly, nursing school is your life. You should be studying as much as you possibly can. Probably I think they say anywhere between 20 to 30 hours a week. But that all just depends because your 20 to 30 hours a week could honestly get you down to 10, depending on if you have, a job, kids, husband, responsibilities, whatever. You know what I mean? So you definitely have to find that time and you got to set aside that time. So if you have a significant other, you better start talking to them and being like, hey, I got this going on. We need to be regimented with our time, unless, of course, emergencies come up. What do you think of online RN to BSN? I'm thinking of FlexPath. So I went to nursing school. Got my BSN all online, except for my clinicals, right? Luckily, mine was before COVID. So, my clinicals was all, face to face. Do it. I'm going to be a trauma nurse. Jackie, that's what I'm talking about. That's the stuff I like to hear. For some, studying small increments through the day help more than doing hours straight. Flashcards, facts. So I like to tell people, get in where you fit in, right? But for NCLEX, I like to say things a little bit differently because you need to be able to build the endurance to sit in front of a computer. All right. And that's why I was like, hey, if you build the endurance and you get the repetition and you practice like you play, like you want when you go and sit at that testing exam, it's not going to be anything different. OK, in school now and loving it. So glad I found the confidence in myself. Ariana, hey, that's my niece's name. So, hey, I'm glad you found that confidence. Keep that confidence. This guy is straight to the point. I love it. Hannah, you must be new here. All right. I don't play no games. I don't coddle. I'm a military guy. Been in the military for a decade and a half, 16 years. So usually when people come to me, I'm going to be like, cool. What you want from me? How are you going to fix it? Remember, hey, y'all, I failed my NCLEX 3 times. I failed my NCLEX 3 times, which is the reason why I created the 7-day NCLEX course. I never want anyone to feel how I felt, like a failure, like they weren't worthy, and that they weren't able to be a nurse, right? That's why I created. That's why the curriculum is laid out the way that it is, right? I tell you my story. I talk about what the NCLEX is so you can be familiar with it. And I make it affordable, because some of these other ones you got to pay, a premium for, or some of these other ones that you have to pay, and you have a subscription. You don't have a subscription. You have it forever, and you get all the updates. You know what I'm saying? So that's why I did that. I'm straight to the point. I'm a straight shooter. I don't play no games. And if you come at me crazy, I'm going to come at you crazy. At the end, somebody's going to win. Most likely it's probably going to be me, but that's okay. Yes, do his best choice I've ever, yes, do the best choice I ever made. Okay, shout out to you. Switch from pre-PA to ADN this semester, and I'm loving it. Flight nurse is my end goal. John, hey, flight nursing is great, man. Flight nursing is great. If you want to go be a flight nurse, and I don't know exactly what but I'm just going to say this anyway. Flight nursing, definitely you need to go to the ICU. I'm not shitting on the ER, but you need to go to the ICU because it's the en route critical care aspect that they want, right? That's what they want. Drips, titration, intubation, all that stuff, okay? And it says, I'm new here, haha, studying for pediatric nurse. Okay, shout out to you. Dominic says, what do you think about high school wrestling? Like going to high school wrestling? I thought about wrestling when I was in high school, and then I got humbled real quick, and I was just like, nah, that ain't for me. But if you want to wrestle in high school, bro, do you? Audrey says, are there other areas of nursing you're interested in exploring in your career? So right now it's nursing education. That's what I absolutely love. I love teaching. I love creating content. I love doing all these things, right? Other aspects of nursing, like non-traditional nursing, I'm all about working from home. I'm all about doing non-traditional nursing jobs. I'm all about, my biggest thing is about education, right? It is all about education. It says, listen, y'all, you can do this. I started at 50 years old and graduated at 55 years old. Everyone can do it. What? It's true. Everybody can do it. Any advice for a static class? Oh my, you mean for statistics? Man, like for statistics, I didn't even like that class, to be honest. And honestly, I don't even know. I think it was Khan Academy. Khan Academy for a lot of things when I was in my prereqs. Mama Bell says, when I was in the RN program, I'd record the lectures and listen to them on the drive. I think it's helped. It will. That is very, very helpful. When I was studying for NCLEX, I would listen to YouTube videos, or I would listen to Mark Klimick, or I would listen to whatever that I needed to listen to acquire that knowledge while I was driving. I usually had like 25 or 35-minute drive to work. So feelings about RNs and long-term care. My feelings about RNs and long-term care, like in a nursing home, is I think nurses that work anywhere are cool, but a lot of the nurses, RNs that work in long-term care, mostly what I find out from my LPN, LVN counterparts is that they're lazy as fuck. So if you decide that you want to work in a long-term care facility, then that's cool. You want to know why? Because we need people there to take care of the older population. That we need that, right? But that just depends on you and what direction you want to go. John says, I'm starting in the ER while I work for my RN to my BSN. Then some ICU time as a BSN. So hey, let me just really clarify. RN. And John, this isn't to say that you don't know this, but for other people, when people say RN, they're referring to as an ADN, right? So your ADN and your BSN are your degree. Your RN is your license, right? So your ADN RN literally is the same RN license that you would have if you were a BSN. So I don't want people to get that confused. You take the same exact test that a BSN would take if you're an ADN, okay? What are your thoughts on CRNA? Jackie, do it. CRNAs are the highest paid nurses in the profession, are the CRNAs. All right. But that is a monster of a school. Not saying that you can't do it, because there's tons of people that have and tons of people that will. The prerequisites are pretty simple. ICU, apply. They want at least a year of ICU, but most people that get accepted, I hear, is anywhere between 3 to 5 years of ICU experience. Get as much ICU experience as you can. Audrey says, I do a case management gig from home. Definitely recommend, but also going into nurse education. Shout out to you, Audrey, because I like nursing. I like education. Like, I never thought I'd be that dude, but I'm definitely that dude. The link for the enrollment center isn't available. Is it under construction? Kayla, what you mean, girl? Hold on. Because we don't like that. All right, hold up for me, Kayla. I got you. I got you. Let me see, because I don't like that. Let's see. So you said that link wasn't working? It took me directly there. So if you're talking about the link in my bio, let's check it. I'm gonna check because you must be in my TikTok, right? So we'll go ahead and we'll check that out. But Kayla, I got you. I'm gonna check that out right now. Give me 1 second. Let me see what everybody's talking about. Most hospitals won't take a non-BSN, especially flight nurse programs. They won't. Yeah. Unless you were like working for the state or working for the city as already like a paramedic or anything like that. If you want to do flight, they want you to have at least 3 to 5 years experience. At least in Texas, that's what I've noticed, right? Why do some providers get so mad if you put their name in a nursing note when situations happen? Because they don't want to be held liable. And let me tell you something right now, Francis. Listen to me, all of y'all in here right now. That nursing note that you are writing in regards to your patient is legal documentation. If a doctor gives you an order, you better write their fucking name in it. You better write their names inside of that note. If you got a telephone order or if they made an order over the computer and you see it, whatever they told you, you better write it because you are not going to carry out an order unless they give it to you. But then also, you're not going to carry out an order if they gave you something that was incorrect. That's where we advocate for our patient, right? Have you done any travel nursing? Ashley, I have not. I thought about doing travel nursing, and then I started getting into, doing course creation and, doing stuff from home, and I didn't want to do travel nursing anymore. So might sound stupid. It's not stupid. I already know where you're going with this, but are you a nurse corps officer? I am not. I'm enlisted in the Navy. I have applied to become a nurse corps officer. And I've been denied pretty much since 2016. I don't know what the Navy wanted. I didn't care. I got my degree and my license all on my own, not with the help of the Navy or the Navy programs. So it's doable. You can get through anything if magic made it. Hey, if you're finding value, smash that like button. Okay. I have 3 more semesters for my BSN. Shout out to you. Amen. Preach. I'm almost done with my bachelor's. I do travel nursing for nursing for LTCs. So here's the thing. Hey, if you're going to start to travel, anybody, if you're a brand new nurse, get at least 1 year to 2 years under your belt before you decide to do anything. Write your notes like you're going to be reading them back in court. Yes, you write your notes like if somebody's going to fucking audit them. That's exactly what you do. Don't ever lie on documentation either. At worst, you're putting a patient's life on the line. Facts. I know that's right. Yes. How long will you continue to do these live reviews? I finish school around this time next year. So I will keep doing these. And then I have some other things that I'm planning that are going to be going, down the line. But I'm going to keep doing these as long as these are beneficial. Kayla, that's all I can say. That could be for another year, 2 years. That could be the next 6 months. It all just depends on how beneficial it is. I go to OD in February. Any advice? OD. What's OD? Did you just quote Kanye? I did, Camille. Kayla, you're welcome. Kayla, let me figure out what's going on with that link because I just clicked on it. Hey, try it again. Try that link again and tell me inside the link tree. Try that again because it should work. Yeah, I just clicked on it right now and it worked. That is exactly what they teach us in school. That's why they make you do. Yes, you gotta love TikTok, ma'am. That's exactly why they make you do it. By the way, I passed my HESI exit. Hey, that's what I'm talking about. That's what I'm talking about. I'm happy for you. I knew you could. I knew you would. I had no doubt, whatsoever, right? ODS. I got you. Okay, I'm going to try again because I need it. That's right. Try it. Try it right now. Also, thebootnurse.com/special. That's simple. It'll take you directly there, okay? Navy Officer Candidate School in Rhode Island. So I actually applied for direct commission. I applied back last year, December. And I've done things, here and there. Still haven't heard anything back. So I'm just going to chill. I'm going to retire, maybe, as enlisted. And I'm okay with that. I have made peace with the fact of there are certain things there are certain doors that will get closed for me, but I know that other doors will open up for me. And I'm okay with that. All right. It says taking my exit HESI December 6th. I'm so scared. Boy's mom too. What you got to be scared? Hey, if you scared, go to church. Okay. That's all I'm going to say. Leadership, pharmacology, management of care, Those are the big, like management of care, leadership, transitions, freaking physiological adaptation. That's exactly what the exit HESIs are made of. Okay. But you got this. You got this. You got this. You got this. Hey, if you guys are finding value, make sure you guys smash that like button. I'm going to hang out here for probably about another 10, 12 minutes. What other questions do you guys have? Like I tell everybody all the time, I failed my NCLEX 3 times, y'all. Three times. But none of y'all would ever know that if I didn't openly tell you guys that. You know what I mean? None of you guys would openly know that at all. Unless I actively told you. BSN or RN. So let me reiterate this for beautiful ambitious. Your BSN and your ADN are your degrees. Your RN is your license. So I am a BSN RN. There you go. I got you. I'm tracking. I'm picking up what you're putting down. Yeah. So I have my RN with I'm an RN with my bachelor's degree, if that makes sense. And I'm actually going to school right now to get my master's degree in nursing education. Advice on planning for NCLEX, how far ahead to schedule, how much to study. Ashley, what's the fastest way? Honestly, the fastest way is to get your ADN, go to a community college, get your associate's degree, and then get your sit for your RN exam, get that license, and then get your bachelor's degree online. Same license, right? I'm in a program for LVN. Then do a bridge program. Honestly, it doesn't matter. It doesn't matter how you get there as long as you get there. LVN, bridge to a RN program, which is an ADN program. Once you get that ADN, RN, start taking classes online for your BSN. Everybody's journey is going to be different. Everybody's like, what's the fastest way for me to get there? You know what I'm saying? Like, fuck it. Like, it doesn't matter. I don't care if you were a fucking homeless bum on the street and then you became a janitor or whatever. And then you decided that you wanted to get your master's. Don't care how you do it. The journey is unique to everybody. So if you're in an LVN program, bridge to an RN program and then start taking stuff online. Trust me when I tell you that. Okay. Advice for planning for NCLEX. You should start studying. Well, I don't know what your situation is, Ashley, but you should start studying now. And you should probably study no longer than 90 days, in my opinion, but no less than 30 days. Okay. Do the bridge. You will see you are more prepared for the RN program. There you go. If you do the bridge, it's just like you won't skip a beat. You won't skip a beat. The only thing that's different is your scope of practice. Like you already know how to do the hands-on stuff. It's just your scope of practice, evaluation, teaching, assessing, right? But being the first one to do it and then using your critical thinking and clinical judgment to make a decision. You know what I'm saying? That's why. That's what it's there for. Okay. Hey, look, first of all, if you're a patient care tech, a medical assistant, a PC, fucking occupational therapy, respiratory therapist, x-ray, all those ancillary services brought for LVNs, especially y'all, LVNs, LPNs, I fucking love y'all because for far too long, the profession as a nurse as a whole shits on LVNs and LPNs. Why? Only God knows why. But the only thing I'm going to tell y'all is that if y'all don't ever hear it, I fucking appreciate y'all. I had a patient care tech one time while I was in the ICU. One time. I had an LVN one time. And let me tell you, that was the greatest thing on earth when I heard somebody say, hey, Kevin, I did all X, Y, and Z for you. I'm like, who are you? And can you please stay here? You know what I mean? So, whoa. Somebody said I passed my NCLEX on my third attempt on Wednesday. Look, Malia, BSN RN, I need all of y'all right now to give Malia love. Tell her congratulations. Tell her how proud of you, how proud of y'all, y'all are fucking proud of her, okay? Y'all tell her down there right now. That's what I'm talking about. Y'all let her know. Do you have a study plan on sale? I don't know how to, is it Yen? I don't know how to say your name. It's Y-E. I'm going to say Yen, okay? I do have a program on sale right now for $97, and it is a lifetime. It is a lifetime study program. It is in my link. It is in my link in my bio, and it is labeled the 7-day NCLEX course. If that link does not work, I just double checked it and it was working. Okay. So y'all let me know if it's not working, but y'all fucking give Malia, y'all give all the love right now. Obviously I don't know how to talk, right? My Rex PN is tomorrow. Second attempt. Rex PN. You mean Your Rexpian, congratulations. I'm proud of her. Me too. I'm proud of her too. All right. Hey, what advice could you give everybody in here? What advice? What's the one thing that you could be able to tell everybody based off of you taking your NCLEX 3 times, being unsuccessful multiple times, and then conquering that NCLEX? You're welcome. How many chances do you get to take the NCLEX? Marcy, it depends on what state that you're in. In Texas, you get 4 years to take it as many times as you want. In Florida, I think it's only 3 times. In Ohio, I think it's unlimited. You know what I mean? It all just depends. I'm going to nursing school, DMS. Shout out to you. California, I'm not sure. Marcy, I would go to the California Board of Nursing and you would be able to see that. It's the NCLEX version. Yeah, that's what I thought. It's the NCLEX version in Canada. That's what I thought. Okay. Because I know, I think if I remember, there's another one that when you're in the Philippines, there's one specifically that you take. Auto, you took your NCLEX and you passed. Girl, that's what I'm talking about. That's what I'm talking about. Hey, y'all already know the deal. Y'all see her. Give her the love. Tell her congratulations. Give her flowers. Her hard work finally paid off, and she is a nurse. She is a licensed practical nurse. The name is inside of it's in the title. I also did purchase. You also did purchase. Oh my God, Malia, hold on. You said, I also did purchase your program. I loved it. I say go to your safest answer. Malia, first of all, thank you for saying what I would love for you to do. If you could go to anywhere, like on any of my, like if you go to anywhere on my pages, and leave that somewhere. First of all, I would love your testimony. Number 1. Number 2, the safest answer, which keeps the patient safe, is always your safe bet, right? So that's what I will tell you. But I appreciate your kind words. I appreciate the testimony. And of course, girl, I appreciate you because now you a nurse out here. Now come over here and get to bedside so I can go home. You know what I'm saying? No, but I appreciate you. I really do. Congratulations. Take a vacation. Take a vacation. Take a vacation for yourself. Hey, what is up? Taylor, hi. Hey girl, what's up? How are y'all? Hey, we usually do Ask Me Anythings after we do sets of NCLEX questions. I do NCLEX questions at 5:30 Central Standard Time, now Monday through Friday. I will definitely write a review. Malia, I appreciate you, girl. I appreciate you. And trust me, I use these for other things, okay? First thing you did after getting your license. First thing I did after getting my license, what did I do? I threw my phone. So I looked and I was like, and I threw my phone. I'm like, yo, that's the only fucking phone I got. I need to go get that, right? And then the next thing I did is I went to a bar. It's called Anchor Bar here in San Antonio. And I went to go eat wings. I went to go eat chicken wings with one of my buddies from work. Hey, look, them chicken wings were fucking delicious. Lemon pepper and salt and pepper, baby, with ranch. Stop playing games with me. Hey, if you ever go to Wingstop, lemon pepper wings, flats only, because we bougie around here. You know what I'm saying? Hey, extra crispy, you know what I'm saying? With 2 ranches. Stop playing with me. If you get in value when I'm telling you about NCLEX and getting my course and fucking chicken wings, smash this like button. All right, stop playing games with me. But I appreciate everybody that's coming through. What other questions do you guys have? I'm going to be here tomorrow. We're also going to do NCLEX questions off nurseslabs.com. Hey, y'all, I recorded 2 videos yesterday. Management of care for the 7-day NCLEX review, as well as basic care and comfort. But right now, inside of the 7-day NCLEX course is the new generation NCLEX review, okay? Where I go over it. It's a mixture of questions and we break questions down together. Gotta love TikTok. After crying through the pinning ceremony, I went to sleep. I bet you probably tired. Kind of like a toddler, you know, when they cry themselves to sleep. Or like with that one girl, she's like, I'm gonna take a nap. I'm gonna take a nap right here. Okay. And that was probably you. But yeah. Also, if you are in need of an NCLEX review right now, I have an NCLEX review. It is the 7-day NCLEX review or 7-day NCLEX course. I have 55 videos that are in there right now. 55. And I am going to put well over 100 videos in there. Content videos, right? Also coming out with some ebooks. I'm coming out with some ebooks. Hey, somebody asked me, they were just like, hey, do you have one for pharmacology? I don't, but I will. Hey, do you have one for peds? I don't, but I will. Same thing with EKG interpretation, all those good things. Those things are coming down the line. Also, I have 100 people in here, so I'm going to ask all 100 of you. In January, I am going to do what I like to call a make shit happen in 30 days, right? Where essentially we are going to do NCLEX shit for 30 days. You feel me? That's what we're going to do. You love your energy? Hey, beautiful. You must be new here. You new here? Because if you new here, baby, I'm going to need for you to hit that like button. I'm going to need for you to follow me. And I'm going to need for you to share me. Not like that because, shit be complicated. You know what I'm saying? We ain't doing all that. However, we going to make shit happen in 30 days. Right? I like to call it we're going to make, or, for marketing purposes, we'll just say make-ish happen in 30 days, right? So in January, if anybody is interested in that, I am actually going to be putting up a wait list and I want to see who is interested in doing it. Stan girl, hey, look, you see that? You see that? Hey, I'm cool out here, girl. You already know how we do around here. What is the pathophysiology of cancer? I don't know. It depends on what cancer it is. 30 days and 30 nights. Look, like Noah's Ark, because that's how we do around here. You have to tell new grads to take the boards as soon as they get out. Yes, I do say that. I tell no one to wait. Hey, as soon as you graduate and you get that authorization to test, that ass needs to schedule that exam. I thought you were Michael from Lost. Well, shit, I thought I was Jason Derulo. Guess I was wrong. But yeah, so yeah, I am going to do what I like to call make shit happen in 30 days, aka it's essentially we're going to do NCLEX group coaching, and I'm going to put it out to the first 10 people that want to be a part of it. But I want to wait. I want to gauge people. I want to see if y'all want that. The same energy that we get up in here is the same energy you would get in group coaching. However, you get so much more. You get so much more. Katie, sign you up, baby girl. You already know the deal. Hey, so y'all, we gonna make some stuff happen. I got some things. You see that shit back there? Y'all see that? That is literally my brain on a dry erase board. All right. And trust me, what I was thinking of, that's on there. That is on there. All right. So with that being said, I'm going to come up with some stuff. Y'all keep coming to my live. That way, when you guys know the lives are going on, when I say it, I'm going to be like, hey, it's live. Hey, the first batch of people that I see up in there, I'm going to be like, hey, congratulations, you're going to be a part of it. Hey, congratulations, you're going to be a part of it. You know what I'm saying? Because once it's done, it's going to be closed off for a month. And I'm just, I got to kind of gauge it to see what the energy is. And plus, I need to make sure what I'm putting out is right. And I got to make sure I have the right folks up in there, too. I love your energy. I have to go, but keep going. Ma'am, I appreciate you being here. I appreciate your participation. This energy is like this all the time until I get off live and then I fall asleep on the floor. No, I'm just playing, but I appreciate you being here. I appreciate the energy is whatever you guys give me, I give it back to you. I promise. So I appreciate you being here. But what other questions do you guys have? Hey, I lied to y'all and I said I was going to get off, but I'm still here. So what other questions do you guys have? Y'all got me to 118,000 likes and I love all y'all because y'all been out here putting in that work. All right. Also, a pathophysiology book. Ashley, we could talk about that. I could write that on the list. Talk about patho. Talk about a little something. We could see. Becca says, sorry, so you know anyone that does CCRN reviews? Becca, I don't. I don't know anyone that does CCRN reviews, unfortunately. However, when I was in the ICU, there were a couple of books that people did recommend to me to study for CCRN. I don't know where they are. However, they're over there somewhere. I will have to find them. What does it say? I was planning on taking 2 weeks after graduation to study before taking it. Thoughts? No, Katie, you study all the way. It says coming from an accelerated BSN program, so I need time to collect my brain after this program. Ma'am, let me tell you something right now. I was also in an accelerated BSN program. So you telling me to collect your brain after you pass your exam. That's it. You don't need, you are in a mode where you are consistent. And so you need to stay that way until you get a license. Okay. Do not let up off the gas right now. You can see the finish line. You can see the peak of this mountain. You were almost there. So until you conquer that ass keeps going. You keep going. Don't you stop. Don't you stop. You need this? Natalie, what up? I'm glad. Hey, I'm telling you right now, stay the course. Stay the course. All right. I'm an RN from Jamaica. Is MedPro a good program to migrate on? I don't know what MedPro is, to be honest. What about the people who graduated 10 years ago? Neo, what about you? What about you? Take tests as soon as you can. Get that number. Facts. Thank you. Almost there. Started in August, 11 months, then done in July. Look, I'm trying to tell you, I have a pharm exam tomorrow. Natalie, we went over some pharmacology stuff today. Just a little bit, but we went over some stuff today. You kind of missed it. You know what I'm saying? Hey, I'm just saying, 7-day NCLEX course. I have 18 videos about pharmacology. 18 videos. Also, if you get the 7-day NCLEX course today, I will throw in the NCLEX Victory Study Guide, which also has tons of pharmacology. Over 700 pages worth, y'all. 700 pages worth of information to include tons of pharmacology, antivirals, freaking antibiotics, antiemetics, you name it, it's in there. You know what I'm saying? So if you want it, check the link in my bio. 7-day NCLEX course is what it's labeled. It's going for $97. All right. Make sure you guys go over there and check that out. What's the process for a psychiatric nurse in Canada that wants to work in the United States? So if you're a psychiatric nurse, there really shouldn't be anything different except for the fact that you need to transfer your license from Canada to the United States. And that's it. I start school in January and I'm so worried. I BS my prereqs and I know I can't do that anymore. Jenna, first of all, I appreciate you being honest, because I can tell you right now, the majority of us all BS'd our way through fucking prereqs, right? Just got off work, Kevin. Did I miss everything? Sky, you missed everything. You already know. I've been on here for over almost 2 hours. Over 2 hours. I'm sorry. So you missed everything. But Jenna, first thing that you need to do, get your time management down. Okay. You got to get it down, because I'm telling you right now, you are going to, if you BS your way through prereqs, you are going to get humbled so fast when you start your first semester of nursing school, okay? So you got to get your time management down. Realize people that are close to you or that are your friends may not be your friends after your first semester of nursing school, all right? You got to be greedy with your time, because your life, unless you are married, kids, family, your life, nursing school, family, and your family has just got to adjust to that, okay? So I would recommend getting your time management down now. Also, everybody that's about to start school, get you an NCLEX course for $97, because by the time you graduate, number one, the price isn't going to be there. And number two, you're going to have everything there. Somebody messaged me who bought the course 3 months ago and was just like, hey, I forgot my password. I'm like, all right, cool. They sent me an email and I looked them up. They were there. I hit reset. It's a part of their package. It sent them a reset. Done. So if you forget it, guess what? It's all of the click of a button to send you a reset for your password based off of the email that you logged in with. Super easy. All right. Also, as a matter of fact, I'm going to show you guys what it looks like right now. Okay. I'm going to show you guys what it looks like right now. So check this out. Let me back this up, because obviously, right? Because that's what the girls in the IC used to say to me all the time. Right. So check this out. Right. So we talk about, if I can get on here, I don't know what's happening. It won't let me do nothing. Right. So here we go. That's me, y'all. So here, check this out. Let me back this up. Right. So we talk about the 7-day NCLEX course, right? Cute little cozy video with me, right? And then also down here, check this out. Got a couple testimonies. I got some other testimonies that are down here as well. I talk about the curriculum. This is me when I worked in the burn center. Hey, if you guys get a chance, go down there and read that story. I talk about the same story all the time, right? And then here's a little bit of testimonies, right? These are the people that I actually helped coach, and they are the pioneers of the course. Everything that I've taught them is what's being put in the course, right? And then here's a couple of other testimonies that are in here as well that is helpful. And then, of course, you get the 7-day NCLEX course, lifetime access, y'all. Lifetime access. But I'm going to show you guys something. This is what's inside the course, right? Here are all the videos, right? Check this out. I got a 7-day NCLEX course. I got a new generation NCLEX course. The 7-day review with management of care, basic care and comfort, that's not even in here yet. Get it for $97 and it's going to be in there here within the next couple of weeks. You see what I'm saying? So, and I'll show you guys also, check this out. We have new generation NCLEX questions, right? Look, let me show you guys. We'll back it up, right there, right? Look, case studies. Let's find the case study. Obviously, I'm lying, right? So there goes the case study, right? That is one of the most important things that you guys need to know with regards to the NCLEX, right? With case studies, you're going to get at least 6 questions per case study. And though they can expand upon the case study, the whole point is to put on paper what it would look like if you had a patient that came into your emergency room, your clinic or whatever, and what would happen throughout the period of time that they would be with you. Okay, so that is the type of the question that you'll get. You'll still get multiple choice. You'll still get select all that apply. You'll still get the newer type of question that you'll get is like the closed question or the drop down questions, right? And then we have anticipated versus not anticipated. Also, you know what? Let me find another one for you. Hey, who likes bow tie questions? Who likes those bow tie questions? I know you do. Hey, we got bow tie questions in here where we break them down together. Okay? We got the bow tie questions that are in there. I know some of y'all don't like them, but this is where you use your critical thinking and clinical judgment in order for you to make a decision. So if I have a patient that comes in here and they start talking about, hey, I have a myocardial infarction, based off of that, what action should I take? What should be the next thing that I should do as a nurse, right? And then what should I monitor in regards to a patient that has a myocardial infarction, right? That is just like if I was to do those steps based off of me being at a clinical setting, okay? And then, so, hey, each video is less than 30 minutes. Each video is 30 minutes or less, all right? You want to know why? Is because as an educator and somebody who has done curriculum and curriculum rewrites, why in the world would I want to keep you in there for over an hour? Even if you have the ability to pause. So I take that ability away from you. I'm just like, hey, here's 30 minutes. Let's do it. You know what I mean? So these are the type of questions that are inside of the review. Okay. Also, for those that said that they were studying for pharmacology, I got 18 videos in here. 18. Look, antibiotics. We talk about antibiotics. Let's look at it. Right. We talk about antibiotics, right? Antifungals, other things, right? Antibiotics, broad spectrum, narrow spectrum. We talk about antibody targets for NCLEX. We go over so many other things, the antibiotic mechanisms, right? Your considerations, right? CNS, all the different type of effects, the other, like your cephalosporins, right? We talk our fluoroquinolones, right? All these different ones, the management for them. And then also in each video, most videos, they have a critical thinking type of question, right? And that is to test you. I like to call them checks on learning, right? But I said critical thinking anyway, but checks on learning based off of the material that we just went over, right? Anybody interested in the 7-day NCLEX course, that link is, click the link in my bio. Bio's right there, right? And it is labeled the 7-day NCLEX course when you click the link tree. It is the very first one, okay? Everybody that gets the 7-day NCLEX course right now will get my $29 ebook, which is named the NCLEX Victory Guide. You will get that for free. I will throw it in there. All right. It's probably not attached to it right now, which is fine, but I'm going to go through one by one and I'm going to add it to your account. Okay. So make sure you guys go over there and check that out. And somebody asked me a question over here. I'm doing a CS and nursing, just about finished with my prerequisite nursing. Any tips? What do you mean you're doing CS? Like you're a culinary specialist? Like, what are we talking about? And so if you want to start getting your time management down for sure. I don't want to take away from my family too much. Big Mike, let me tell you something right now. If you ain't trying to take away from your family, that's cool. I understand that. However, this is where we have to take the accountability to where we have to talk to our family to let them know what you are about to embark on. Time management is your fear. You can't have the fear of time management. You have to embrace it, because I'm trying to tell you, embracing the time management now will help you with your career for nursing as well with your family, okay? It's not to try to scare you. It's just to keep it real, right? Computer science, okay, got you. So the biggest thing is you want to get your time management down for sure. Time management is 100% for sure. Does anyone know of an RN online program? I did prerequisites at San Antonio. Oh, Irene, I got you. So I went to SAC for my prerequisites, and I went to St. Philip's, and I went to all of them, right? I went to St. Philip's. I went to Northwest Vista. I went to all of them. So look at Texas Tech's online BSN program. Also look at Texas A&M in Corpus Christi. You can also, I know they have a Chamberlain here as well. I think there's a hybrid program. Also look into Western Governors University. Boom. You're welcome. You're welcome, Irene. Now, hey, if you guys are finding value, make sure you guys smash that like button, okay? But the antibiotics that we go over, talk about broad spectrum. Which ones? I'll go over here. We talk about bacteriocides and bacteriostatics. What else? Pediatrics. We talk about penicillins. There we go. Penicillins, the cephalosporins, the fluoroquinolones, right? We talk about, a whole bunch of them, right? So, but like I said, that's 22 minutes long. That's 22 minutes long. Irene, you're welcome. Right. But that's 22 minutes long. I want to say there's one video on here that's like 33 minutes long. And I didn't want it that long, but that's just how long maybe it's like legal rights or nope, that's 17 minutes. But anyways, but here, hey, we talk about the computer adaptive testing. We talk about the passing standard and the NCLEX test plan that was updated on April Fool's Day. No, it's not a joke. No, it's not a game. Literally, that's what they did. As a matter of fact, I'll show you. It's a 25-minute video, right? We talk about the different things that come with it, right? Talk about nursing competency. That is what they want. They want you to be competent, critical thinking, communication, cultural competence, leadership, ethical practices, lifelong learning, and professionalism. Because that essentially, like as a nurse, you will continue to grow and you will continue to learn all the time, right? You guys notice that, right? This is the client needs. These are the client needs, right? Those are the 8 sections, right? So 1, 2, 3, 4, 5, 6, 7, 8, right? Yeah. So these are the things that you need to know, right? And I talk about them every single time. Every single time I do an NCLEX review or anytime I do a review at all, right? Talk about the structure for clinical judgment. We talk about, the NCLEX test plan versus, NCLEX test plan from 2019 versus 2023. So I just put these up here a couple of months ago, right? And so here are the differences like from 2019 and 2023. Notice, well, let me go back, but notice how they're from 2019 to 2023 for safety and infection control and management of care. They brought this one down a little bit, but they brought this one up. Right? They brought it up. Okay. So there are things that have happened based off of those, right? And here are the old types of questions versus the new types of questions. Case scenarios, extended multiple choice, the drag drop answers, extended drag and drop, highlighted text. I also have highlighted text questions that are inside of the NCLEX review. Just made the purchase of the said day NCLEX course. What next? Use it. Definitely use it, ma'am. Definitely use it. All right. You got to go through the process, right? You got to go through the process, right? So the 7-day NCLEX course. Oh, also, since you just bought it, I'm going to see the list of people that bought it anyway, but I'm going to go through and I'm going to send you the book. I'm going to send you the NCLEX victory guide. All right. I got you as soon as I get done with this live, right? So look, here's another example, right? When I'm talking about on the test plan, right? The extended drag and drop, risk modifiers, what's some other ones? The closed questions, like your selects, right? Select like which one. These are essentially kind of like fill in the blanks, right? Your highlighted portions, right? If everybody can see that, right? Highlighted portions, your anticipated versus not anticipated, right? Based off of what's going on in your case study. So this is your matrix grid, right? And then of course, your other, the changes that happened on April 1st, right? So I go through all of that. Right? And I tell about different key points. When it talks about the nursing process with clinical judgment and how to answer these questions, these are the key points, right? And then, of course, that's how we end it, right? So that's essentially, that's the NCLEX test plan. And we could talk about computer adaptive testing. Hey, with computer adaptive testing, this is how it goes, ladies and gentlemen. This is how it goes. I'm going to show you right now. I purchased and started using it and I'm so glad that you love it. All right. So when you guys get questions, by the way, when you guys start NCLEX, every single person is above the passing line, right? They're going to give you a question. It's not going to be moderately difficult, but everybody should be able to get the first question right. Everybody. But if you don't, that's okay. When you get the question right, they're going to give you a harder question, right? When you get the question right again, they're going to give you a harder question. If you get this question wrong, they are going to drop you and give you an easier question. The goal on NCLEX is to get to the hard questions. Okay. The goal on NCLEX is to get to the hard questions. All right. And the whole goal is to stay above the passing line. It's to stay above the passing line. Once the test can determine the level of difficulty that it can give you questions, you will start to bounce like this. You'll go up, down, up, down, up, down, up, down. Okay. That is what they want. And that's what you should expect. And we talk about the different type of questions, the pass fail rule. There's multiple ways that you can pass or you can fail. 95% confidence interval rule, max length, and run out of time. This almost happened to me on my third time taking my exam. Or I'm sorry, on my second time taking the exam. Okay. And you guys just missed, I was kind of like talking trash into the camera, right? And it says, why does the NCLEX use computer adaptive tests? And I go through that, right? Talk about the different levels of question difficulty. Hey, if you are getting a question that has to do with memorization, like if I ask you, what is cranial nerve for? That is a remembering type of question. That is not a passing level question. Right? I want to get to where we're applying our critical thinking and our critical judgment, and we're analyzing in order for us to make a great decision, a clinical judgment type of decision for our patient. That is what the NCLEX wants. Okay. You got to remember that. You got to remember that. And we talk about, once again, we talk about all these other when will the NCLEX shut off? When you run out of time, when the computer determines you have passed or failed, or if you reach the maximum number. Right now, the maximum number of questions is 150 questions. It was 265 questions, right? It was 265. Be glad you don't have to do that anymore. Okay. But ladies and gentlemen, that is partially what is inside the 7-day NCLEX course. And like I said, once you get it, you have it forever. You have it for a lifetime. All right. So with that being said, I think I had 1 or 2 people check out the course, right? Hey, so I'm going to go in there and I'm going to look, and I'm actually going to send you the NCLEX victory guide. If we purchase during Black Friday deal, do we get the book as well? Yeah. So if you, no. So that's only for today. That's only for today. If only for today, if you purchase it, you would get the Black Friday deal which is where you get the, you would get the Black Friday / Cyber Monday deal. Only for today is where you would get the ebook. Okay. But what other questions do you guys have? I stayed on here like a lot longer than I said that I was going to stay on here, but I'll give y'all another 10 minutes. What other questions do you guys have? I'm going to be on here tomorrow, same time, 5:30 Central Standard Time, Texas time, because that's the only time that matters, right? Unless you're in El Paso, because they're on Mountain Time, so that's different. So 5:30, I'm going to go through some more questions again. I'm going to go through the same spiel again. I also had already put out there if anybody would be interested in making some shit happen in 30 days. So I'm gauging the consensus. In January, I'm putting together something which I like to call make shit happen in 30 days. AKA, we are going to be putting pedal to the metal when it comes to studying for your NCLEX in 30 days time. But we're going to make it in a group. We're going to make it in a group session. Okay. So if anybody is interested in that, make sure you guys keep coming to my lives. Make sure you guys check out everything I have going on, as well as check out all the other products that I have going on. But most importantly, be here for the lives, because this is where I announce them, right? This is where I announce them. All right. What other questions do you have? Is the 7-day NCLEX course live classes, or are they pre-recorded videos? They are pre-recorded videos. You must have just joined in here, because literally like 60 seconds ago, I just turned the camera around. So they're pre-recorded videos. Pre-recorded videos. I'm in El Paso and I feel left out. Haha. Jackie, ain't nobody tell you to live over there. Okay. That's okay. Is it MT? That's okay if you just got here. So yeah, they are pre-recorded videos. Right now I have 55 videos that are inside of the 7-day NCLEX course, and it's going for $97. You get it for a lifetime. Okay. And right now, my 7-day review, AKA with management of care, pharmacology, so on and so forth, that is currently still in production. But if you buy it, you're going to get it anyway. You get it for a lifetime and you get all the updates, right? But right now, what's in there is the new generation NCLEX review, where I go over 100 questions to include case studies that are in there, showing you how to break the question down, talking about breaking the question down, as well as topics and all this other stuff. So my wife just agreed to buy the course for me. I'll use it for my LPN, then my RN. Look, hey, and that's what it's for. Big Mike, That's what it's for, bro. That's what it's for, right? And the thing about it is like, it's not like you don't know where to find me. Y'all know that I'm here. Y'all know that I'm religiously here on TikTok. Y'all know y'all can email me. Y'all know y'all can follow me on Instagram. I'm on YouTube. You know what I'm saying? All these go on YouTube. All of these go on YouTube. You know what I mean? So if anybody ever forgets or doesn't get to see when I'm going over the NCLEX questions, you guys can still find them there. All right. Big Mike. Hey, if wifey's saying that you get it, hey, you're about to get that and you're going to get the ebook as well as, here's the thing. When you get the ebook, any updates that I make to the ebook, everybody that purchases it or gets it is going to get free updates for the ebook as well. I make that actually a thing for all ebooks, right? Right now, I just have the victory guide, which is everything. But now I'm going to separate them because some people just want peds. Some people just want cardiology. Some people just want EKG interpretation, stuff like that. So I'm going to put that in there as well. Where on YouTube do we find it? So you can, so my handle on YouTube is The Boot Nurse. Also, that link is in my bio. If you go to the link in my bio, all of my everything is in there. Instagram, of course, TikTok, Facebook, the Facebook page, the YouTube, the 7-day NCLEX course. If anybody wants one-on-one coaching for NCLEX, where we break down NCLEX style questions together, you get my phone number. We create a study calendar for you. We create a tracker for you. You get hour-long plus sessions with me where we break stuff down. Check that link out also in my bio, which is labeled the NCLEX one-on-one coaching, right? You don't just get coaching for the NCLEX, ladies and gentlemen. You get coaching for the NCLEX. You get coaching and mentoring for when you become a new grad nurse. It doesn't matter if you're an LPN or an RN. It does not matter. And there are things that I don't even have enough time to explain on here, that so many things that you can do as an RN and an LPN that these schools don't tell you. Okay. It says, I'm excited about the purchase. I graduated December 15th. I plan on taking my NCLEX shortly after that. Honestly, beautiful soul. I really think that what's in there right now, and I've already had multiple people tell me that they've used it with stuff that's been less in there that has been super helpful for them, especially the new generation NCLEX, right? So hopefully before the time that you graduate by the 15th, the whole 7-day NCLEX review is going to be in there. Like, this is about to be dense. It's about to be dense. And I want everybody to love it. This isn't my review anymore. This is y'all's. And y'all help me do it. What kind of patient can I do for a broken tib and fibula? I don't even understand what that means. I will reach out to you. Is it prasia? Okay. Who gave me the little dude with the heart? Just boom. I appreciate you, Glenn. I appreciate you, sir. Big Mike, it says you're giving out a lot of stuff for free. It shows that you care. Keep it up, bro. Hey, like I said, I will keep doing this until you don't want me here. I'm waiting for one person. Oh, pressure. Is it pressure? It says okay, pressure. Got you. I got you. So hey, I'll keep doing this until people don't want me to. Until somebody's like, hey, what you're doing is dumb. I'll be like, all right, bye, y'all. And in reality, I'm just going to give that person the 600 so they can kick fucking rocks. You know what I'm saying? Because we don't let people's feelings determine how we feel. You know what I'm saying? Because we don't play that game around here. We don't play it around here. What other questions do you guys got? I usually say I'm going to stay on here, but then I get held hostage. So Glenn says, I really appreciate you, young man, encouraging the youth. Sir, this is what I'm about. This is what I'm about. Like, when I was a surgical tech instructor, this is what I did. I had to be very stern. Like, it's kind of like off of Full Metal Jacket. He was just like, I am hard, but I am fair. You will not like me, but the more you will hate me, the more you will learn. I realized that I can't do that with everybody, but my students really did appreciate the fact that I was tough on them. But especially, it's just like when they come back to me now and they're just like, hey, I really appreciate everything that you did for me. I've been in the Navy for 16 years, and mentorship is what it's just, it is, if you find the right people, mentorship is instilled in you from the very beginning of anybody's military career. That's why I tell everybody, it doesn't matter if you're a nurse going into the military or whatever, find somebody that is like-minded like you, hold on to their coattails and learn all the positive things from them so you can grow within whatever organization that you're a part of, right? The one thing that I hate is nursing schools and all these other people telling people that you need to just be a bedside nurse. That's not true. Just because you're an RN or an LPN that does not mean that you belong at bedside. However, there are things at bedside that you have to do if you're trying to climb that ladder of being a CRNA, you want to do flight nursing, if you want to be a nurse practitioner, a clinical nurse leader, if you want to try to climb the clinical ladder at a hospital. Like, those are things that the hospital or those places are where you have to be. Okay. You just have to be there. Now, what I'm saying is that as an RN or an LPN, you do not only have to do that. There are other non-traditional things you could do. I mean, you can go work at a clinic. You can go work at an aesthetic clinic and pump people full of Botox and do a day spa thing. I mean, obviously, I don't have that problem about lip filler, you know what I'm saying? Because Lord have mercy. But what I'm saying is that your license, whether you are a LPN or an RN, is versatile. It is versatile. Versatile. You know what I'm saying? It is so versatile. Like, you are the CEO of your license. More information about 2024 30-day make ish happen. More details, please. Nia, I just announced it because I wrote it. I had it in my head and I wrote it down. That's it. I ain't even got no details for you, but it's coming. Trust me, those details is coming. Nia, trust me, I ain't forgot, because I already put it out there. Now people are asking me about it. So Odie says, this might sound stupid, but which is better to have an ADSN or an ASN or a BN? It doesn't matter, because Odie, it's the same license. Okay. Like, here's the difference. 2-year degree, 4-year degree. That's it. Now, with the 4-year degree, of course, you get more like of the research, the management, so on and so forth, right? Now, when it comes to doing the actual job, it is nothing different. You have the same credentials that I have as a BSN nurse or as a BSN RN. You have the same credentials that I have if you are an ASN RN. The biggest thing is that these hospitals are pushing everybody to get a BSN because it's really about money. It's really about them having a magnet status, because the more BSNs that they have, the more qualified that they are, the more money that they get from the state or that they get from the federal government. That's what that means. Right. And they'll try to tell you, hey, we're only hiring BSNs. For any hospital to really be picky about having BSNs when there's a nursing shortage, and there always has been, that's really blown my mind. Like, it really, really has. I never understood that. So how dare you try to say that you don't want a 2-year nurse? Now, here's one thing I will tell you, is that if you do plan on climbing the ladder, or you do plan on, increasing your education, the easiest way to do it, if you're going to go straight RN, is to get your ASN first. Go ASN RN and then do BSN, because you do it all online. Like I said, it's the same nursing license, BSN, and then go MSN or whatever you decide that you want to go and do after that. So, Glenn, thank you for the follow. Is it Creative Deco? Creative Deco. Kind of like Deku. A shout out to anybody that watches My Hero Academia, because that's exactly what I was about to say. But shout out to y'all. Thank you for the follows. Appreciate you. Hey, but what other questions do you have? What other questions do we have? Hey, y'all got me to 120,000 likes. That is the most likes that I've ever had. I have 120,000 likes, and we had 1.2 thousand people at one point that were in here watching me run my mouth talking about questions with y'all. And y'all made that happen. You know what I'm saying? And you already know the deal. We got to shatter that. Sarah says, hi, Kevin. I take my exam this week. Would you recommend studying the day before? Absolutely the hell not. So what day is your exam, Sarah? Sarah, first of all, Sarah, you came in here already knowing the answer. You just want me to verify that. You already know the answer. When are you taking your exam, Sarah? Let's see. Thursday. On Wednesday, I better not see you in nobody's live. I better not see you here in my live, because I'm going to give you a 600. Hey, and if you guys are new here and you guys don't know what a 600 is, 600 means 600 seconds, which equals 10 minutes, which is how long I'm going to ban that ass. But in reality, I'm just going to ban you forever. I just like saying 600 because it's different. And I heard one of my favorite YouTubers say it. So hopefully he doesn't have that shit trademarked, because I don't need a cease and desist letter, because 600 is catchy. Let me tell you. So on Wednesday, you need to be trying to relax as much as possible. Okay. That is exactly what you need to be doing. Okay. You want to know why, Sarah? Is because you've prepared for this. Okay. You've prepared for this. And if you don't know it by now, and if you're not at least familiar about what you're seeing, you don't know it at all. And that is the straight facts. Straight facts. I had an instructor a long time ago when I first joined the Navy tell me that, and he was right. If you've been studying like you should be studying, like you should be for it, there's no need for you to study and cram. You're only gonna psych yourself out after that point. Okay? So if you don't know it by now, you don't know it at all. But Sarah, you are good. You are good to go. I want you to hear me in my voice. I want you to hear my voice. This succulent, like buttery smooth, like cutting through like filet mignon steaks, right? I'm pretty sure that's not how you say that. But I want you to hear me say, Sarah, you're good. Keep going. Sarah, you're good. Keep going. And then I want you to come back here on Friday or Monday or whenever the fuck you're going to come back here. And I want you to tell us that you passed your NCLEX. That's what I want. That's what I want. And that's what everybody else wants too. All right. So I better not see your ass here on Wednesday. I better not. And you better not come under an alias. You better not be with a friend. You better not be trying to hang out. Relax. You're good. And you got this. All right. But hey, ladies and gentlemen, that is it for me. A couple of housekeeping items. 7-day NCLEX course. Sarah, you're welcome. It'll come back Friday. All right, cool. I better see you here too. And now you better be the first one waiting. I'm telling you right now. But 7-day NCLEX course, y'all, $97. If you get it before midnight, you will get the NCLEX victory guide for free. I will throw that in there and I will go in and I will add it to the, I can see everybody that jumps in between now and then. All right. So I will add it to everybody that jumps in there. All right. It is $97 and you get it for a lifetime with all free updates. You don't got to worry about nothing. Right. And if you need one-on-one coaching, check out the NCLEX one-on-one coaching and mentoring. Those links are in my bio. Make sure you guys go over there and check those out for yourself. Right. You want to know why? Because you're trying to make some shit happen. And I love being here with y'all to make some shit happen. All right. Also, check out my other links like Instagram, my YouTubes, all that other good jazz. Right. Also, be kind to yourself. Love yourself. You only got one you. You only got one you. Take care of yourself. Of course, take care of your family. Right. But it's only one you. If you can't take care of you, can't take care of a spouse, can't take care of them kids. Why? Because fuck them kids. I'm just playing. I love my kids. All right. But seriously, take care of yourself. And I will see everybody tomorrow at what time? At what time? 5:30 Central Standard Time, right? Texas time. That's the only time that matters unless you're Jackie and you live in El Paso. Sorry, Jackie. Sorry. But I will see everybody tomorrow. Same time over questions. Peace.